And bonjour à toutes et à tous. Sorry for the delay. Désolé des délais. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. So before we begin, for those joining us on Zoom, you may select audio interpretation to hear today's briefing in your preferred language. It's usually at the top or at the bottom menu. Avant de commencer, je souhaite indiquer aux personnes qui se joignent à nous par l'entremise de Zoom qu'elles peuvent suivre la séance d'information d'aujourd'hui dans la langue de leur choix en activant Interprétation en langue. If you have any issues, please feel free to message me privately. Si vous avez des difficultés, n'hésitez pas à me contacter directement. During the presentations, if you are using a desktop or laptop, click on View option to select the PowerPoint in French or in English. Unfortunately, this option is not available if you're using a mobile app or your tablet or your phone. De plus, pendant les présentations PowerPoint, vous pouvez cliquer sur l'option Affichage et sélectionner le français ou l'anglais. Also, a reminder to place your microphone on mute until you are invited to ask your question. Nous vous demandons également de bien vouloir désactiver votre microphone et de le réactiver que lorsque on vous invitera à poser une question. So this morning, we will be hearing remarks from Mayor le Maire Jim Watson, followed by Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, président du Conseil de santé d'Ottawa. Our presenters for today include, aujourd'hui nos conférenciers seront Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence, and Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Available for questions from council assistants and media following the statements, we also have disponible pour répondre aux questions des membres du conseil, des adjoints des conseillers et des médias. Nous accueillons également Marie-Claude Turcotte, Manager of Immunization at Ottawa Public Health, gestionnaire de l'unité de la vaccination, Santé publique Ottawa, and Ryan Perrault, Director, Vaccination Task Force, Directeur, Service de la gestion de la distribution des vaccins. After we hear from the panelists, Councillor Keith Egli will take questions from council members or their assistants in order of city wards. Une fois que nos conférenciers auront présenté, le conseiller Keith Egli répondra aux questions des membres du conseil et de leurs adjoints dans l'ordre des quartiers de la ville. We will then take a 5-minute recess and resume with questions from the media. Après une pause de 5 minutes, nous répondrons aux questions des médias. Thank you very much for your patience. At this time, I would like to invite Mayor Jim Watson to say a few words.
Thank you very much, Kina. Merci beaucoup, Kina. And good morning, everyone. Bonjour tout le monde. My thanks to all of you for joining us at today's technical briefing, members of council, as well as members of the public and members of the media. I'd also like to recognize, as has been pointed out, Keith Egli, who's doing a remarkable job as chair of our Ottawa Public Health. Anthony DiMonte, General Manager of Emergency Protective Services, who's also heading up our Distribution Task Force. And the incredible Dr. Vera Etches, who is leading our fight against COVID in the city of Ottawa. The purpose of today's technical briefing is to provide you with an update on our plans for offering the COVID-19 vaccine to residents of our city. There's no doubt that COVID-19 has had an immense impact on our community and our residents. And I know that many of you watching this today are tired and eager for the vaccine to come in large quantities for our residents. As you'll learn more today, we need to manage everyone's expectations regarding the distribution of the vaccine and when it will become available to them. Comme vous en apprendrez plus d'aujourd'hui, nous devrons gérer les attentes de chacune concernant la distribution de vaccins et le moment où il sera disponible pour eux. Dr. Etches, Anthony DiMonte, Councillor Egli, and our Vaccine Distribution Task Force have been working tirelessly on our vaccine distribution strategy. The plan they are putting forward has my full support. This is a complex process that involves departments from all over the city. Most importantly, it's grounded in public health principles. Dr. Etches will be providing further details about our approach and plans to ensure that those who are most vulnerable and at risk will be prioritized for the vaccine. Ottawa's work is significantly affected by provincial direction as well as vaccine supply provided to us by the federal government. Mr. Demonte, the city's general manager of emergency protective services, will go into detail about the various dates for vaccine, or rather various roles, vaccine rollouts, logistics, and the phased approach for distribution shortly. As you'll hear today, we have a solid plan and we are ready to ramp up very quickly. Now, despite the recent delay in receiving the vaccines, we are pleased with the progress we are making with the administration of the vaccine to those in our community who are most at risk of contracting COVID-19. More than 92% of long-term care home residents have received their first dose of the vaccine, and 100% of the long-term care homes have been visited at least once. We've also offered the vaccine to staff and essential caregivers in our long-term care homes. Now, the city's mobile vaccination teams are working exceptionally well and hard. Les équipes mobiles de vaccination de la ville font un travail exceptionnel. Bravo. In the coming days and weeks, we'll begin the second doses in long-term care homes because we have to wait for that period, as well as the first doses in retirement homes, congregate care settings, and to health workers at highest risk. The exceptional work of our paramedics and OPH staff has earned the praise of Prime Minister Trudeau, as we heard last week during one of his press conferences. And last week, I was on a call with the Premier, General Hillier, and mayors from across Ontario. And on 3 separate occasions, the Premier and General Hillier noted how well Ottawa has been doing in delivering the vaccine. I want to offer my congratulations and gratitude to all involved in this well-deserved recognition from our provincial and federal counterparts. I want to take a moment now to speak about the vaccine itself. There's been some misinformation and myths going around that questions the safety of the COVID-19 vaccines. Dr. Etches has spoken about this recently, and she'll be addressing the topic as well today. And I want to echo her message. The vaccine is safe and it is effective. It is one of our best defenses against COVID-19. La vaccine est l'une des meilleures défenses contre COVID-19. I encourage residents to get their information about the vaccine from credible sources like Ottawa Public Health, our medical officer, Dr. Etches, and our healthcare professionals. Now, we know that distributing and administering the vaccine is significant, as a significant undertaking, one that isn't going to happen overnight. So much of what we can do is dictated by the supply of vaccine we receive, so we must be ready to be flexible and understand that this will, of course, take time. But let me assure you, we will provide a COVID vaccine to all eligible Ottawa residents who want one. In the meantime, we need to continue to follow the provincial orders, the directions given to us by Dr. Etches and her team at OPH. And remember, every one of us has a role to play. Stay at home unless you need to make an essential trip, such as to a medical appointment, to the pharmacy, or to get groceries, or for exercise. Remember to limit your close contact to those living in your household. Wear a mask, practice physical distancing, practice proper hand hygiene, and please stay home if you're feeling ill. And before I conclude, I want to speak to the colleagues on council and members of the public and media, speak about the issue of travel. To reiterate the words of the Prime Minister, now is not the time to travel, either internationally or even across the country. Traveling to Florida for March break is not essential travel. We need to stay home as much as possible, and I can't think of a worse place in the entire planet to go to than Florida at this point, which is a massive hotspot in the United States. We need you to stay at home, as I said, as much as possible, and let's continue to work collaboratively so that we can limit the spread of COVID-19 in our community. Thank you very much. Merci beaucoup. And I'll hand it over to, I believe, Councillor Eglai, who's going to chair the meeting. Thank you.
Thank you very much, Mayor Watson, and thank you, Kina, as well. Hello, bonjour, kwe. Thank you all for joining us today. I'd like to start by acknowledging that we are on the traditional unceded territory of the Algonquin people. As Mayor Watson has already stated, we are pleased with the progress we are making with the administration of the vaccine to those in our community who are most at risk of contracting COVID-19. As you will no doubt see today, staff has been hard at work for weeks developing strategies and consulting with community groups to ensure a successful campaign. With Ottawa encompassing over 2,700 square kilometers geographically, larger than the cities of Toronto, Montreal, Vancouver, Calgary, and Edmonton combined, staff has stepped up to meet the significant logistical challenge to vaccinate every eligible resident who wants one. Especially important are our relationships with community partners who will continue to be integral to our efforts in responding to COVID-19. I'd like to thank our partners in the community, such as the hospital staff, the long-term care staff and operators, Ottawa public health nurses and paramedics, and first responders who have already stepped up to provide significant support to the effort. I'd also like to thank the Emergency Operations Center Command Team, led by Ryan Perot, for their leadership thus far. Elected officials play an important role in the success of the campaign, whether it's sharing the most current information with constituents or helping to manage expectations regarding the distribution and availability of the vaccine. I'm happy to see so many of my colleagues in attendance. An informed council will help support the work done by staff. It's important to remember that we all play a role in our community's response to COVID-19. While the vaccination campaign is ongoing, we must continue to do our part as individuals. Make no mistake, while we are making progress, we are still very much in the thick of this. Practice physical distancing, wear a mask as much as possible, wash your hands frequently, and stay home except for essential reasons. These tools and strategies will continue to bring down COVID rates and are important to maintain in the weeks and months ahead as we roll out our vaccination program. With that being said, I'd like to turn it over to Dr. Vera Etches, Ottawa's Medical Officer of Health, and Anthony DeMonte, General Manager, Emergency and Protective Services, to provide an update on the vaccination process and current situation. Over to you.
Thank you, Chair Aguilar. Good morning, everyone. Bonjour tout le monde. I'm happy to be here to provide you with an update on behalf of the City of Ottawa's Emergency Operations Centre. As we learned last week with the news that Canada would not receive any Pfizer shipments this week, the situation with vaccines remains extremely dynamic. Right now, all levels of government are dealing with the reality that there is very limited supply of approved vaccines and an insatiable global demand. We understand that everyone wants life to return back to normal, and that for many, this depends on accessing a vaccine. Indeed, that's what all levels of government, the city and its partners, are planning to provide. I can assure you that despite the news from Pfizer, the city's Emergency Operations Centre is continuing to explore all options to accelerate our ability to administer vaccines to the residents once larger quantities of vaccines are available in the coming weeks and months. La Ville continue d'étudier toutes les options visant à accélérer notre capacité à vacciner les résidents au cours des prochains mois, semaines, lorsque nous disposerons des grandes quantités de vaccins. As we plan ahead, we ask everyone, please remain patient. It will take some time for Ottawa to receive the vaccines we need from senior levels of government. Once we do, we will be ready. Nous serons prêts. If you could go back to the previous slide, please. I'm just on that slide now. Thank you. To vaccinate Ottawa, the city is collaborating with a number of partners who are working together in our service to the community. We are truly one city, one team. The city partners include, but are not limited to, Ottawa Public Health, the Ottawa Hospital, L'Hôpital Montfort, Queensway Carleton Hospital, CHEO, Long-Term Care and Retirement Home Administrators, the Champlain Local Health Integration Network, Ontario Health, amongst others. It is expected that additional partners will be engaged as the vaccine rollout expands in the coming months. Next slide, please. I want to take a moment to go over where we started from the vaccine front and where we are now. We knew back towards the end of last year that we needed to start to mobilize and plan for the arrival of the first vaccines. The city has been in a declared state of emergency since March 2020, and all city departments have been actively engaged in the pandemic response since that time. In preparation for an approved and available COVID-19 vaccine, the city announced that the creation of the COVID-19 Vaccine Distribution Task Force on November 16th. Following our announcement, the province announced its own COVID-19 Distribution Task Force on November 23rd. On November 9th, Health Canada approved Pfizer-BioNTech COVID-19 vaccine, And soon after, the Ottawa Hospital was selected as one of the first 2 locations in Ontario to receive and administer the Pfizer vaccine, which began on December 15th at the Ottawa Hospital Clinic. Peu de temps après, l'hôpital d'Ottawa a été choisi comme l'un des 2 premiers établissements en Ontario à recevoir et administrer les vaccins de Pfizer, un processus qui a commencé le 15 décembre à la clinique de l'hôpital. Following this, Health Canada approved the Moderna 19 vaccine on December 23rd. Into 2021, the city's COVID-19 Vaccine Distribution Task Force and Ottawa Public Health knew that the recent approval of Pfizer and Moderna vaccines brought us into a new phase of our emergency response. This meant that we had to restructure the Emergency Operations Center for 2021 to set ourselves up for success and to meet the new demands that the vaccine distribution will bring to the city. With this restructuring, the COVID-19 Vaccine Distribution Task Force evolved into a command team. This move made sure that we were a stronger level of integration, respecting the ongoing multifaceted response to the COVID-19 in the city's Emergency Operations Center. Also, on January 4th, the Pfizer BioNTech vaccine was approved for transportation, which meant it could be taken directly to long-term care homes and administered to our city's most vulnerable. The very next day, on January 5th, the first vaccine was administered in a long-term care home in Ottawa. And on January 17th, we announced that the first doses of vaccine had been administered in all long-term care homes of Ottawa, of which 20 were vaccinated by the city's mobile vaccination teams. I can't stress enough how important this was for our city. What a success it was. Within 11 days, we were able to pilot a new vaccination delivery model and complete all of the first doses in our long-term care homes. This was the most that could be done based on the number of vaccines that we had. And the City of Ottawa, Ottawa Public Health, and the Ottawa Hospital achieved it effectively and efficiently. As we speak, all 3 levels of government are working together to deliver vaccine to Canadians. Everyone has a specific role to play. Tout le monde a un rôle précis et important à jouer. The Government of Canada is responsible for purchasing vaccines, approving them, and distributing them to the provinces and territories. The province of Ontario received the vaccines from the federal government and is also responsible for the prioritization of population groups and the distribution of vaccines across the province in accordance with its ethical framework. Right now, the Ottawa Hospital has been receiving Pfizer vaccine from the province, in part because it has the ultra-cold freezers capacity to store it. To date, Ottawa has not received any Moderna vaccine from the province, which has a less extreme cold storage requirement. Once Moderna or similar vaccines are made available locally, it is expected that Ottawa Public Health will store, administer the vaccines in accordance with the provincial ethical framework and will be supported by the City of Ottawa. The full role of Ontario's public health units and municipalities in the COVID-19 vaccine distribution will continue to be informed by the province's rollout plan, which is expected to include alternative delivery agents, such as the use of pharmacies and family doctors' offices, among other strategies. The provincial rollout plan is expected to evolve over time as vaccine supplies increase. As Mayor Watson mentioned earlier, and I think it is important to point out and mention again, our goal is to provide a COVID-19 vaccine to all eligible Ottawa residents who want one. Notre objectif consiste à vacciner contre la COVID-19 à tous les résidents d'Ottawa admissibles qui le souhaitent. We also want to continue to build and maintain confidence in the system to ensure that people want to and will get vaccinated. From recent public health poll results, it shows that approximately 80% of our residents are interested in receiving the vaccine. We want to and need to keep these numbers up. I now want to take a moment to go over the structure of the Emergency Operations Center and how the command team and the operation group function. At the top, we have our Emergency Operations Control Group. The members of this group are responsible for overall strategy and policy direction and comprise the city manager, all department heads, the chief of police, Ottawa Public Health medical officers of health, all the chiefs of the emergency services, paramedics and fire, public library, and others, as well as our hospital partners. This is where the strategy is decided. Under that, we have the Emergency Operations Command Team. The EOC Command Team, which was previously the COVID-19 Vaccine Distribution Task Force that was modified at the beginning of the year, deals with the consequence management and continuity of citywide operations. So it has a global view. Then the Emergency Operations Group, which responds to and manages the operational needs of all the service areas. The response to COVID-19 is complex and multifaceted. It is important to remember that this structure exists in support of all EOC operations in 2021, not only vaccine distribution, and could perhaps have to manage our spring freshet if we have one, or any major emergency that may come along as well. Next slide, please. Thank you. Here's a bit of a closer look at the structure of the command team. You'll see I have myself as the incident commander working closely with Dr. Etches. And this teamwork has been both essential and collaborative since the beginning to ensure that we've had a very functional and operational approach to this need, led by medical science and best practice. Supporting the commander, we have a group including the Emergency Information Officer, our Emergency Operations Liaison, the Hospital Liaison, Council Liaison as well, Intergovernmental Relations, and the Secretariat. This slide illustrates the extent of the City Operations Group. You'll see there are 5 primary sections with a total of 18 task force to address a plethora of specific needs arising from our community's multifaceted, multidisciplinary response to COVID-19. As you can see as well in the recovery section, very important task force that were set up early on continue to be operational, namely the economic recovery, human needs, people, and service. Teams under this group have already secured contingency freezers, ordered and received additional supplies, and set up city storage and packing site when non-Pfizer vaccines are received in Ottawa, amongst many other early achievements. Communities across Ontario must plan to administer vaccines in accordance with the province's ethical framework for COVID-19 vaccine distribution. Les communautés d'Ontario doivent se préparer à administrer des vaccins conformément au cadre éthique pour la distribution des vaccins contre la COVID-19 de la province. There are 3 phases to the province's plan, which continues to evolve based on vaccine supply dynamics. The first phase, which began December 15th, and is the one that we're currently under, sees limited doses of vaccine available for our highest risk residents and their caregivers first. People in this group include residents, staff, and essential caregivers in congregate living centers that care for our seniors. It also includes a select group of healthcare workers defined by the Ministry Healthcare Guidance, adults in First Nations, Inuit, Métis populations, and adults who are receiving chronic care at home. The province estimates that phase 2 could start in March and will go until July, again, depending on vaccine supply. In the second phase, an increasing stock of vaccine will be available to older adults, starting with those who are 80 years and older, residents and staff who live and work in high-risk congregate settings, such as shelters and community living, essential workers, beginning with frontline essential workers, such as first responders, teachers, and workers in the food processing industry, people with high-risk health conditions, as well as their caregivers, and other high-risk populations. The province anticipates that the third phase of the vaccine distribution could begin in August, again, depending on the availability of vaccines. Phase 3 is when vaccines will be widely available across Ontario for anyone wishing and eligible to be immunized. Le gouvernement provincial estime que la 3e phase de distribution des vaccins pourrait débuter au mois d'août, selon la disponibilité des stocks de vaccins. Cependant, cette phase, que les vaccins seront disponibles partout en Ontario pour toute personne qui le souhaite être vaccinée. It is important to note here that for the majority of the population, it will be several months before you will be able to get vaccinated. Il est important de noter que la majorité de la population devrait attendre plusieurs mois avant de recevoir le vaccin. The systems and processes for booking appointments are also being set up by the province for use across Ontario. We are working with our provincial government on what will this going to be look like for Ottawa. Once it is time to roll out vaccines to a broader population, we will communicate to residents and let them know how they can access vaccines. Lorsque le vaccin pourra être offert à la population générale, nous communiquerons avec les résidents pour leur indiquer comment procéder pour y avoir accès. This time will come as the vaccine supplies increases, and we will vaccinate residents most at risk from the effects of COVID-19. I'd now like to turn it over to Dr. Etches, who will discuss this in a little more detail.
Merci, Tony. Bonjour tout le monde. I just wanted to thank Tony for explaining this response so far and the framework, and add in from a public health perspective, we absolutely recognize that age is the overarching greatest risk factor for hospitalization and death. And so we know that first and foremost, of course, the results, the protection we need to increase is for long-term care homes and retirement homes. The residents have had the most devastating outcomes. And beyond that, we are working with the province to make sure, again, the age dimension is prioritized, reaching people who are older adults. Again, greatest risk of hospitalization and death is certainly something that is recognized, and so more details about how we proceed through the age groups will be coming as again we work with the province and identify how that will roll out.
Next slide, please. Thank you, Dr. Etches. I also want to assure everyone today that we are ready and prepared for this rollout. Aujourd'hui, je tiens à vous assurer que nous sommes prêts à distribuer les vaccins. Our plan is scalable to meet supply. Under the first phase, vaccinations will continue to be carried out by the Ottawa Hospital Clinic, the mobile vaccination team, and immunizers in congregate care settings that provide care for seniors. In phase 2, distribution of the vaccines will be expanded to mass immunization community clinics and may also include additional hospital clinics, pharmacies and physicians' offices, and through mobile vaccination teams. Also note that the mobile vaccination teams will be used to serve high-risk neighborhoods as identified by Dr. Etches and her team, and our important rural communities and the geographic challenges that we have to assure that we meet in Ottawa as well. Under the current provincial plan, phase 3 vaccinations will likely take place in community clinics, pharmacies, and physicians' offices. Next slide, please. As I mentioned earlier, our vaccine plan in Ottawa is scalable, meaning it is flexible to scale up to use vaccine supply as soon as it comes in. When we move into phase 2 of vaccine distribution, our plan is to offer up 7 community clinics, which would have the capacity to administer 8,400 doses per day. We could scale up to these 7 clinics or scale down to offer few based on variables like vaccine supply and deployment of our mobile vaccination teams. Combined with the capacity of the hospital clinics to administer 2,400 doses of vaccine per day, that would mean that we could have the capacity to administer up to 10,800 doses per day in Ottawa, 7 days a week. We are also preparing and looking and are committed to go faster if vaccine supply is there. And we're looking at the potential of things like a 24/7 clinic to speed up process, as long as we have the vaccine supply to make that possible. I also want to take the opportunity to go into a little more depth about the mobile vaccination teams who have been doing great work in the first phase of the vaccine rollout. They have been hard at work vaccinating residents, staff, and caregivers in 20 of our 28 long-term care homes in Ottawa. Each vaccination team consists of 3 paramedics, 1 public health nurse, and 1 OPH staff member who work closely both with Ottawa Public Health and the city's hospital network. Pharmacists from the Ottawa Hospital and CHEO have been training members of the vaccination teams in the process of vaccine dilution. They are also trained to transport and administer the vaccine safely and effectively and provide patient care. To give you a bit more insight of how these teams work, each of the paramedics have a different role to play to ensure patient safety as the teams administer the vaccine. 2 paramedics provide the injections, while the third paramedic stays with the individual for 15 minutes following the injection to monitor for any reactions. The Ottawa Public Health nurse provides overall coordination, while the OPH staff member offers administrative support. Several of these teams have been deployed to a single location based on the number of people required to be immunized. The work of these vaccination teams are doing is no small feat, and I'd like to echo Mayor Watson and thank them for their hard work, as well as their dedication and commitment to helping our most vulnerable residents. Le travail que font ces équipes de vaccination relève de l'exploit, comme le maire Watson l'a fait avec moi. Je tiens à les remercier pour leur travail acharné. I also want to provide you with some background as to the vaccination process at long-term care homes and the process being used by the mobile vaccination teams. Before the vaccine even gets on site, we have the administrators of the home and ask residents to sign their consents. Also, a team has to go on site to check and make sure all the safety measures are in place. Then we carefully transport the vaccine to the long-term care home, and upon arrival, the vaccines are prepared. The mobile vaccination teams perform the immunizations, then monitor those who receive the vaccine for any adverse reactions. Following this, our team completes the required documentation. I'm now going to hand it over to Dr. Etches, who will talk a little more about the lessons we've learned from recent flu clinics and how to help the community prepare for for COVID-19 community clinics. And if you could go back to the previous slide, please. Oh, I apologize. It is slide 14. Thank you, Dr. Etches.
So thank you again. I want to note that Ottawa saw the highest uptake of influenza vaccine in its history during the 2020-2021 influenza season. Au cours de la saison grippale de 2020-2021, la ville d'Ottawa a enregistré le taux de vaccination contre l'influenza le plus élevé de son histoire. And we used the opportunity to collect feedback from a lot of people. 21,000 people gave us feedback. So you can see on the slide, the mechanism worked. People appreciated the clinics, the staff, the respect, the access that people had. Certainly, we got some feedback that people were interested in additional locations, more appointment times, and we're using this information to guide our next mass immunization clinics. Also, we found it's very, very useful to partner with primary care providers. That extends the number of immunizers. It provides them with the appropriate venue with infection prevention and control measures all in place. An online booking system was very useful, and Mr. DeMonte mentioned we're looking for tools from the province, but we can build on the online booking system that we use locally if needed. We will use similar layout, the flow in one direction, the way people came in to the reception and processed through to the waiting areas. Again, 7 days a week, likely 12 hours a day. And it's an experience that we will build on. So that's the main points, Tony. I'll pass it back to you for a moment.
Thank you, Dr. Etches. So we've identified our first 4 community vaccination clinics. They are, as you see here, the Horticultural Building in Lansdowne, the Eva James Memorial Center in Canada, 255 Centrum in Orleans, and the Pean Sportsplex in the South End. We've also established a facilities working group to identify 3 additional locations for community clinics, understanding that there are specific provincial requirements for these sites. It's also important to note that under the provincial framework, there will be access to vaccines outside the community clinics in places like pharmacies. Il est important de souligner que, conformément au cadre provincial, les vaccins seront offerts d'ailleurs dans les cliniques de la ville, notamment dans les endroits comme les pharmacies. I also want to point out that the 2 Barrhaven sites that were used for this year's flu vaccinations, the Mary Pitt Center and Chapman Mills Community Building, will be consolidated into a single site at the Nepean Sportsplex. This location will have the capacity to meet the combined volumes of both sites and also will not impact our immunization capacity. Based on the flu clinic model, we anticipate that each of these sites will be able to vaccinate 1,200 people per day. as we are looking to identify 3 additional sites for phase 2. 7 clinics would provide up the capacity to vaccinate up to 8,400 people a day. Next slide, please. When the time comes for residents to get the COVID-19 vaccine, they will see a familiar layout similar to the flu vaccine clinics that Dr. Etches has just talked about we've held in the past. We're going with what works, and we're tested and established floor plans based on successful flu vaccine clinics. So you will see we have pre-screening areas, which are followed by a check-in area. Following that step, residents will go into pre-vaccine waiting room, after which they will be called into the vaccination room when it's their turn. After they receive their vaccine, they will go to the post-vaccination waiting room, where they will wait to make sure they have no adverse reactions to the vaccine. And finally, they will proceed through checkout, and in some cases will be booked for their next appointment, because you have to have 2 vaccines, a second vaccine rather, to be fully immunized. We have a lot of logistics to take into consideration with regarding organization of these clinics. From the people standpoint, we have to ensure staff working at the clinics are scheduled and trained, and they must also have a recent negative COVID-19 test. Provincial booking system will need to be tested so that residents have specific time to receive their vaccination. The IT professionals in our EOC are working with our provincial counterparts to make sure that the technology, infrastructure, and support will be available in all the clinics. And with guidance from the province, we will need to manage the vaccine supply and track patient information, which is key, as residents will need to receive their second dose of the vaccine, the same vaccine that they got in the first dose. So if we have multiple vaccines in Ottawa, that also has to be tracked to ensure that you receive the second same dose several weeks later. We will also need to plan for traffic, parking logistics, both community and hospital clinics, to ensure a good flow of people and to make sure the locations are easily accessible. Next slide, please. As for the logistical considerations for our assets, there are also a number of things we need to keep top of mind, including the safe transportation of the vaccine, supplies, clinic technology and data management, the cold storage of vaccine as well as safe handling and distribution, vaccine inventory management, and security. I'll now turn it over to Dr. Etches, who will discuss vaccine sequencing in more detail. Dr. Etches?
Well, as the COVID-19 vaccine rollout has begun, there are many questions about the sequence or the order in which people will be offered the vaccine, given that we're going to have supply of vaccine coming in stages and it's limited. So we are following the ethical framework and the priority sequence for COVID-19 vaccination that comes from the province. This is because there's a limited amount of vaccine, and we want to have an equitable distribution. So the ethical framework is based on some principles of stewardship, of trust, of transparency, and equity. The framework does look at the patient population risk of exposure, the risk of severe disease or outcomes, and the health system capacity that needs to be in place to ensure ongoing care. I'm going to mention a bit more that we have a local application of the framework is needed, and so we have established a vaccine sequence strategy task force, which includes members from groups highly affected by COVID. Un groupe de travail sur la stratégie de séquençage des vaccins locaux qui comprennent les membres de groupes fortement touchés par la COVID-19 a été mis sur pied afin de conseiller le centre des opérations d'urgence de la ville sur la façon de mettre en œuvre le séquençage des vaccins en fonction du contexte actuel, ce qui comprend de maximiser la participation des groupes placés avant les autres. J'en dirai plus à ce sujet dans an instant. So given the assumptions and the availability of vaccine, we're continuing to work with the city's Emergency Operations Center to do all that we can to ensure that residents who want to receive the COVID vaccine will be able to access it as quickly and efficiently as possible. So within the ethical framework, it sets out and the provincial sequencing, it sets out broad groups, and we have to then make decisions locally about how this is implemented over time. So we want to have a transparent process that promotes equity, as I said, and public trust, that people can see who is being vaccinated and why. So an example of decisions already that we had to make was determining which long-term care homes or which retirement homes in Ottawa should receive the vaccine ahead of the others in that group. So it is this sequencing task force is co-led by Ottawa Public Health and members of the Champlain LHIN. A member is co-leading. That is Ontario Health. And the task force is informed by people from diverse priority population groups disproportionately impacted by COVID-19. So they will make recommendations to the overall response about how to sequence vaccines, how to interpret the provincial guidance, and consider local factors. This task group was also making recommendations on how to promote uptake of vaccine among groups that are going to be sequenced as we go, and to make sure that we're addressing any barriers to vaccination. So the groups included are from populations such as newcomers, First Nations and Inuit populations, Black populations, older adults, and healthcare workers, both hospital and community. So part of transparency and our commitment to describing what's happening with vaccine and the rollout is to put up vaccine information on our dashboard. So the Ottawa Public Health dashboard, it now has information there along with all the COVID numbers, hospitalizations, rates, testing. This data is currently showing the vaccine doses administered, the number of doses received for the province, and the first doses administered to long-term care home residents. So we'll continue to update this information on Mondays, Wednesdays, and Fridays. And as we look into the coverage for different populations, we'll look at how to present this information. So adverse events following immunization are of interest, of course, to all of us. They're an unwanted or unexpected health effect after someone receives a vaccine that may or may not be caused by the vaccine. So in Ontario, all healthcare providers are required by law to report what we call AFIs. These AFIs are reported to local public health, so Ottawa Public Health, and we investigate all the reports. We enter the information into a provincial tracking system, and this gets rolled up to provincial and federal levels so that even if something is very rare, it could be picked up and examined across the country. Usually, the examples of adverse events could be more pain or redness around the injection site that lasts, say, beyond 4 days. If somebody had an infection at the injection site, a rash around the injection site. More serious events would be anaphylaxis or seizures. And so these are the kinds of things that we assess. And we have received a small number of reported AFIs in line with what we would expect from other vaccines, and they're all being investigated and reported up. I also want to take a moment to talk about vaccine hesitancy. We know even before the pandemic, the World Health Organization declared the threat to international public health is vaccine hesitancy. And certainly this is not helped by the amount of misinformation, disinformation, and even scams that are out there on the internet. So we are working to make sure that the public knows where to access credible information from Ottawa Public Health, their healthcare providers. We've really grown our website and resources for people to learn about the COVID vaccine. We have a vaccine work page that has frequently asked questions and dispels myths. So we've started a social media campaign specifically dedicated to myth busting, and we'll continue to use all of our media platforms and work through also word of mouth within communities, drawing on different networks to spread the word. We've developed a COVID decoded video series that addresses common questions. It's featuring Dr. Trevor Arneson, one of our Associate Medical Officers of Health. And our Parenting in Ottawa Facebook page also has a weekly COVID vaccine true or false question that is getting very good response from parents. Also, encouraging information, I believe was just alluded to earlier, but I'll share a bit more. We've started an ECOS survey, a population level survey that's providing quantitative results for people in Ottawa related to the vaccine and the interest in getting the vaccine. And from the first week, it started January 11th, 83% intend to get the vaccine when it's available to them. Most said they would get it as soon as possible. And the intent to vaccinate does increase with age. So for people aged 18 to 29, the intent was 76%, and it was up to over 100%, well, 100% for those over age 70. So the most common motivator for those to be vaccinated is that they feel this will help us get back to a more normal life. We're going to continue this survey with ECOS, and we'll report on the results every 2 weeks. Further, we are continuing the Engage Ottawa platform to have a two-way dialogue with the population about vaccines. We would like to hear people's perspectives about the vaccine and concerns. This survey, Engage Ottawa platform, is open until February, but we're starting to hear already from the population. Certainly, there seems to be disappointment in the slow speed of the vaccine distribution. People want to know more about, how the phases will work, how the clinics will work, how vaccines will be prioritized. Bon nombre de résidents ont hâte de recevoir un vaccin contre la grippe COVID-19. Les résidents syndiquent de l'approvisionnement en vaccins et ne croient pas qu'il faille allonger l'intervalle entre la première et la deuxième dose plus longtemps que ce que le fabricant recommande. Les résidents sont déçus de la lenteur de la vaccin distribution. Aussi, les résidents veulent en savoir davantage au sujet du déploiement des vaccins en Ottawa. So we will continue to learn from the input there and provide information back to the public. There are a few examples here about some of our messages to address vaccine hesitancy on social media. We certainly find that communicating regularly, using humor on social media is important to get the public health message across. So this one here was related to the holiday season. The next example, is showing us there's research now about how to combat misinformation, and it is to call it out when warranted. So we are doing that to address the idea that there's a conspiracy behind the vaccine program, for example. Et parfois, le message le plus simple est le plus efficace. So turning to the subject of community engagement, there is a lot of engagement through communication channels, but we also need to have direct connections with people. And so we are looking to make sure that, for example, populations at highest risk are informing the rollout. So, to help us understand the long-term care home residents and employees, continue to give us feedback as we worked to get them the vaccine. We're talking to people from congregate care settings, older adults. Our First Nations, Métis, and Inuit partners have been providing input and are ready to do their part to immunize their communities. So we will continue to hear from populations through our community engagement table, as well as these other avenues I've mentioned so far. Les relations entre la santé publique et les partenaires communautaires sont cruciales afin de bâtir la confiance dans la population générale, y compris dans les groupes prioritaires. So I I would like to just say a little bit more about how we're working with certain priority populations. The Ottawa Hospital and again the Champlain Lynn have helped with reaching out to the healthcare providers who have been able to receive the vaccine first. We certainly have relationships with long-term care homes through all of the response to the pandemic, and we've built on that to provide credible information. When it comes to Indigenous communities, there is a liaison for vaccination that has been established. It's the Wabano Center for Aboriginal Health and a Kausavik Inuit Family Health team who are intending to establish vaccination sites to be able to provide the vaccine directly. And we know that there also are Indigenous specific education and awareness campaigns and work underway to promote the vaccine. When it comes to neighborhoods that have been more affected by COVID-19, again, we'll build on the existing relationships and community serving organizations work to make sure that we are addressing any barriers. I want to pause to say that we have seen, of course, that low income can be associated with poorer health status. We've seen this with COVID-19, but there is a precedent in the influenza campaign that Ottawa Public Health runs every year of tackling that inequity. So when we look back, we see that, in fact, the coverage of influenza vaccine does not have that same gradient with lower income populations having less protection. And that's what we're aiming for, to use the vaccine campaign to address the inequities in health and provide that protection. So there is, again, a specific there are many different channels already established with the Community and Social Services Department, the Human Needs Task Force, the Ottawa Health Team that we'll continue to use. And people with disabilities and rural residents are also on our mind because of the challenge potentially to get into a site that is stood up at a fixed site. And so again, this is where some of the mobile processes that Mr. DeMonte described will come into play. So I'll just again say more that we would like to hear from anyone who would like to give us feedback. So the Engage Ottawa platform is there. It's mentioned on the slide. It's available at engage.ottawa.ca/COVID-19. Nous encourageons les résidents à faire entendre leur voix et à échanger leurs idées. Et cette phase d'engagement se terminera le 12 février 2021. Visitez participants.ottawa.ca/COVID-19. So to conclude, there is a lot we can do now. Vaccines will become available to everyone in Ottawa who wants them. And while we're waiting, we know that we have the tools to keep COVID levels low in our community. In fact, wearing masks and keeping distance between others outside of our household is critical for many months to come. We have done it before using these tools to reduce the level of COVID in our community, and doing that now, continuing those routine new behaviors that have become routine is actually going to make the vaccination program more effective. If we start with lower levels of COVID in our community, we'll be able to contain COVID with the vaccination program faster. So I do encourage all of us to continue to do our part and stick with those basics. Again, limiting our contacts with people outside of our household, just knowing that COVID has asymptomatic infections. It can be within our friends and family and circle of gathering with people close to us to really take care. So I will end there, and I'm happy to take questions along with Mr. DeMonte.
Thank you, Dr. Etches. We will continue to minister all vaccine supply that we receive in Ottawa. Nous continuons à administrer tous les doses de vaccins que nous recevons à Ottawa. Our next steps are to administer the second doses in all our long-term care homes, This week, for instance, the second doses will be administered at the Pearly Rideau Veterans Healthcare Center, which was the first long-term care home to be vaccinated in Ottawa on January 5th. The rest of these homes will follow, many with the support of the city's mobile vaccination teams. We will then move on to first doses in priority retirement homes as identified by the public health team by the criteria that they are using, congregate care settings, healthcare workers who are at the highest risk, as well as our Indigenous population and chronic home care recipients. So the order and hierarchy are already predetermined. And I want to make it clear that although we are ready and prepared to administer more vaccine as soon as supplies allow, it will be several months before the vaccine is available for the general public. Il faudra compter plusieurs mois avant que le vaccin soit offert à la population générale. So to recap our key achievements, the city's new EOC structure was set up in 2021 and has been stood up. 4 community clinics are ready to open, subject to vaccine availability. Contingency freezers and other supplies have been ordered and received. Transportation of the vaccine from the city's storage and packing site is in place for when Moderna or other vaccines arrive. 25,350 doses of Pfizer BioNTech vaccine have been received and 23,833 doses have been administered. 18,544 of these were administered at the Ottawa Hospital Clinic, with the other 5,283 being administered by our mobile vaccination teams. The first dose of the vaccine has been made available to all 28 long-term care homes, 20 by our Ottawa mobile vaccination teams. More than 92% of all long-term care home residents have received their first dose, 97% at the city-run facilities. And in one high-risk retirement home and 1 congregate care home with older adults also have been provided the opportunity to receive their first doses. We're also committed to keeping our city councillors up to date. Nous sommes également résolus à tenir à jour les membres du conseil municipal. 6 memos have been sent to councillors over the past 9 weeks from Dr. Etches and myself, which have covered the city's emergency response efforts and provided COVID-19 vaccination updates. Another great tool, as Dr. Etches mentioned, is OPH's COVID-19 daily dashboard. The number of vaccines received and vaccines administered will appear in the dashboard and will initially reside in OPA's vaccination and testing page. These numbers will be updated every Monday, Wednesday, and Friday. Beginning last week, the incident commander of the EOC command team started to provide regular updates to councillors' offices, which includes an updated FAQ document to assist with inquiries from residents. And in addition, the council liaison and command team will continue to assist councillors with inquiries from residents. Next slide, please. We encourage everyone to stay informed about COVID-19 vaccine and our vaccination efforts. Nous vous invitons à rester informés sur le vaccin contre la COVID-19 ainsi que sur nos efforts en matière de vaccination. Thank you very much. Merci beaucoup. And as Dr. Etches said, both her and I are available for questions. Back to you, Chair.
Thank you, Dr. Etches and Mr. Demonte. And your teams for the extraordinary and collaborative efforts made over the last few months. You know, we often say we're all in this together, but that's also in the response at the city level as well, between the various departments and staff members. So thank you for working so collaboratively in responding to this situation in our community. I'm going to open the floor to questions from council members or their staff. Now, while this isn't a committee or a board meeting, we're going to try and follow the 5-minute rule as much as possible so that everybody has an opportunity to ask questions. And we'll go in order of Ward, Councillor Lula for his 5 minutes.
Thank you very much, Mr. Chair. Listen, this is a great plan, Tony and Vera, and I know a lot of hard work has gone into this. I'm really proud of our paramedic service for stepping up and helping to administer vaccines to all LTC residents in Ottawa. Merci à Pierre Poirier et à son équipe pour leur travail acharné et leur dévouement envers notre ville. Sommes-nous préoccupés de ne pas recevoir les vaccins nécessaires pour administrer une deuxième dose à nos résidents de soins de longue durée à temps?
Maybe I can take that. Dr. Etches and I'll try to tag team here. So Vera, if there's anything you want to add, please. So certainly with the announcement, voulez-vous que je réponde en français ou en anglais, comme vous voulez?
Comme vous voulez.
Well, certainly with the announcement this week of a stop in Pfizer vaccine, and perhaps in the next couple of deliveries as well, maybe diminished, the first task that we had to do was go back with the team. As you know, currently the Ottawa Hospital receives all the vaccine for the Ottawa area because we only have the Pfizer vaccine, and the Ottawa Public Health team and the Ottawa Hospital are doing as we speak, the math, as we say, to look at the vision in the next week, who will be due for their second dose, what we have in hand, what we believe we may be getting from the province, and analyze whether there is a delta there, a gap that needs to be filled. As well, the medical officers of health and the CEOs of the hospitals have had a meeting with the province, and there's been some direction from the province. They've asked that information be uploaded to the province, and they're taking that and they're looking at a broad provincial analysis of the same problem. Are there gaps as we project who needs their second dose? So that work is being done as we speak today. I can tell you at the end of the week, we have enough to begin our second dose process. But again, we have to wait and see what the math says of the analysis to see if there's gaps. And I'm sure the province then will step in to assist us if we have gaps, because then we have some challenges. Dr. Etches, I leave it to you if you want to add anything.
Yeah, I would like to add that from a medical point of view, we are following the National Advisory Committee on Immunization's recommendations that the Pfizer second dose should be given within 21 to 28 days for the residents in long-term care homes and retirement homes, because that's the population we're trying to protect, and it's an older population where there's theoretical, based on other vaccines, thought that boosting the immune system with a second dose may be more important in older adults who may mount less of an immune response. Again, no one studied this specifically with this vaccine yet. And the National Advisory Committee on Immunization recommends that in a situation of low supply and high community transmission, that we look at using that first dose and then potentially following with a second dose up to 42 days. That's a period where people in the studies sometimes had their vaccine up to that point in time. And again, we don't have data about exactly how far out can you push that second dose and still have the same kind of immunity. We see after the first dose, from the limited numbers in the studies, that the effectiveness in the vaccine can be up to 92%, and then going up to 95% with the second dose. What we know from other vaccines is that the second dose is used to boost longer term immunity, so that we look out and the final endpoint of how much of an immune response the body mounts isn't affected by a delay in that second dose. So this will be studied further, but the National Advisory Committee on Immunization is confident in making that recommendation, and the province is following that. So the province is not intending to delay second doses beyond that 42 days. As Mr. Demonte said, the math is being done to figure out where we need to move the vaccine, even potentially across the province, to make sure that all the people who receive their first dose receive the second dose by that 42 days. And again, for residents, as Mr. Demonte said, we are able to do that second dose within the 28 days, which is why we are keeping some vaccine right now, just to make sure that we do that and meet those targets.
Great. Okay, I'll try to keep these really short because I want to be respectful of my colleagues. Have we been advised as to when we can expect to receive our next shipment of the vaccine?
We have not. We've got some preliminary information from the province, but as you can understand, because of the announcement of the stoppage in vaccine, the moment of pause now is asking every public health unit and the hospitals to do the analysis of what they have. That's being fed up, and then they're looking at, as Dr. Etch has mentioned, our priority long-term care. Let's get their second doses, and then what do we have left? What needs to be moved around? So there have been numbers put out, batches that we're supposed to get, but I think the more prudent thing now is to wait till we get official word, and I think that's what the province is doing right now, doing a broad analysis.
Okay, one last question. What percentage of our first responders, PSWs, nurses, and doctors have already received their first dose of the vaccine?
So just to make that clear for you, so the priority when we got Pfizer was to do the long-term care residents and the retirement home residents and the workers in those institutions. So those were the target groups. With regards to first responders, break them up into two groups. The healthcare workers, so the paramedics, fell into a select group of healthcare workers, which included staff that worked in the emergency departments, ICUs, and/or COVID units in hospitals. So it's a very small group of healthcare workers. They got their vaccine, the first dose. Not everyone. It's a small amount. I don't have the exact number, and I can provide that with you. I'll get that for you. But for instance, I know the paramedics, it was only 50 or so, because those were the ones that were going into the long-term care. And the same thing with the healthcare workers. The broad healthcare workers we didn't have enough vaccine to do everyone. It was just those specific groups. So as well, those groups. The first responders, so the other ones, the police and fire, for instance, they come in phase 2 with the essential workers later on, as you saw in the presentation. So I can get you, I'll follow up with you, Councillor, with those exact numbers.
Thank you, Mr. Monte, and thanks so much. As a particularly smart group of people coming after me, I have more questions, but I'm sure they'll ask them. So go ahead. Thanks.
Thank you, Councillor. Next is Councillor Dudas.
Wonderful. Thank you very much. And thank you for this very informative presentation. It actually instills a lot of confidence in how this is going to roll out. I was curious, once someone receives the vaccine, how should they behave? Should they continue to wear a mask? Is there in the anticipation that they need to continue to social distance? I think there's a lot of information out there, and I think it would be beneficial to have that clarity as to whether that should change their social behavior.
Thank you. I will take this one, I guess, Mr. DeMonte. We know from the studies of the COVID-19 vaccines that they protect people from severe illness. So they protect the person who is immunized from being hospitalized or having more significant illness. We don't yet know if they prevent a person who is in contact with COVID virus from picking up the virus and having a less severe infection, an asymptomatic infection that could still pose a risk to others around them, still pass on the virus without knowing it. This is the challenge with this virus, these asymptomatic infections. So we have to study this, and it will become clearer as more of the population is immunized. We'll be able to assess this. But at this time, we can't assume that the vaccine stops that transmission. And so there's actually no change in the behaviors that each of us need to take to prevent COVID transmission. We all need to continue wearing masks. We all need to continue having 2 meters distance from people outside of our household and limiting those contacts that are close contacts as much as possible. And that's the same for workers. All of the screening that is done, for instance, in long-term care homes, the testing for COVID, once a week or more, these things have to remain in place. And it's not what we want. We're looking for more freedom than that, but we can't let our guard down. We still see outbreaks in long-term care homes. The vaccine is still introduced, and we need to stop it being transmitted within those settings and across other workplaces. We have quite a number of workplace outbreaks right now. And so again, workers need to have the masks. They need to have the distance between each other as much as possible and maintain these behaviors.
I noticed that the community care clinics, the 4 that have been identified so far, and then the anticipation of the 7 that they're going to be rolled out across the city. And I'm very grateful to see that there's one in the East End and in other locations. I know that you also have the mobile clinic, and I know that some do not have easy access to public transportation, maybe can't afford to have a car, and maybe aren't located close to even a pharmacy. So I'm just wondering, As the rollout continues, how will you identify those communities that might need access to it? Will you use the mobile clinic or team to go access them? What's the plan in regards to those segments of our population?
So yeah, that work is being done currently by one of the task force in our EOC right now, and they're looking at that as the next phase, and that'll probably be in the mass vaccination phase, because as you saw in the earlier phases, for instance, for older adults 80 and over, and then they're going to do tranches as we go along. We're going to use mobile strategies for them, so we'll be able to target them. But yeah, that's something we are currently looking at. How can we access that? One of the strategies, as you've just described, could be some of the mobile teams, more specifically to go there. We are mapping out the entire city with regards to what you've just described, pharmacies, physicians' offices as well too, to see where those gaps could be, and particularly the rural areas, Navin, for instance, in the East End, those type of communities will probably have some sort of mobile clinic that'll be set up. So we are aware of that challenge, and we're looking at it. So as we go down into each of these specifics areas, we're doing the macro, and now we're starting to zoom in on some of these more detailed challenges that are going to be a little more difficult to achieve, but it's on our radar, and we're working actively at that right now.
And I'll just add that it's Ottawa Public Health's data also around who is more at risk for COVID infection and which neighborhoods have higher rates of people testing positive, that is also informing the neighborhood-based strategies and increasing access to communities at higher.
And my last question very quickly, and it kind of feeds into what you just said, Dr. Etches, is, you spoke about the sequencing and how this will roll out. Most definitely we need to focus on our most vulnerable. A lot of us are parents, and our children are at home, and getting them back to schools is absolutely essential. Where do children fall in terms of the sequencing?
At this time, the vaccines are not recommended for children. The studies so far have involved people over 16 or over 18. And so, I think the studies are starting to look now at children down to age 12. But at this point, that's not a population eligible for the immunization. And, we do want to protect those at greatest risk of hospitalization and death. And fortunately, children are not likely to have severe infection. But we'll update you if the situation changes.
Thank you very much.
Thank you, Councillor. And Councillor Harder is next. Not sure she's on the line. Okay, we'll move to the next councillor then, and that's Councillor Suds.
Thank you very much, and good morning. First of all, I wanted to extend my thanks for, I think it was mentioned, 6 memos to council of late. I know I'm personally finding these particularly useful, and so I'm very thankful for all the effort that's going into preparing those and getting that information out to us to share with our residents. One of the questions that I am frequently getting, and so I thought I'd pose here today, is around how residents will be notified when they are eligible to be vaccinated. This is coming in quite a bit, so I'm wondering, what is the plan around that communication to residents?
So there is a communication strategy. Part of the team, we have a group that's looking at communications, and that's one that's extremely important, because we want to ensure that from a medical standpoint, Dr. Etches and Public Health are giving us the right information to communicate. Our hospital partners are communicating the same thing. In simple terms, Councillor, this morning and some of the other discussions that we've had and the memos that we've sent you, it's really the phased approach. So that is what we're going to stick by. I can assure you that when we're ready to open up either our clinics and the next tranche of individuals that are eligible for that will be communicated through all our public communication strategies at the city, through our media groups, with our media partners that will be asking us questions after council, and all the public health and website as well too, and the city website. So all those mechanisms will be used to let people know, all right, and we're going to do that ahead of time as well too. So give them advance notice that, you know, next week we're opening up the 4 community clinics, for instance, mass clinics, and these are the people that are eligible. So you can go online and start booking through the booking system that the province is developing. So I can assure you that the communications will be broadly done, publicly done. You will be advised as well too, your offices, and we'll make sure that everybody in the city knows when we get to those next elements. And I'm certainly looking forward to that, because right now it's a question of we've got a heck of a lot more demand than we do have supply.
Agreed. Maybe diving a bit deeper on that. Another question that I'm getting frequently is around in phase 2, what or how are we defining other high-risk populations? Has that been defined?
I'll let Dr. Etches talk a little bit to that.
We don't have all of the detail yet on how the province is continuing to look at the prioritization over time. So we have the broad outline that Mr. Demonte presented for sequencing the vaccine. My understanding is that there are provincial committees, subgroups looking at how to define those at highest risk, say within the chronic disease conditions category, or how to define communities at higher risk, due to socio-demographic variables. Within the Indigenous communities, there is also work underway to prioritize within that population, First Nations as populations. So the province is continuing this work. What I would underline is that age is the most important factor. And so we will use that as an overarching prioritization approach, in terms of we need to start with older adults and move down, in order to really tackle where hospitalizations and deaths are occurring.
Okay, excellent. Thank you. That's helpful. And maybe one last question. You've talked today about the 4 different community centers and possibly 3 more that will be utilized for vaccinations. Has there been any consideration of drive-through sites as well as leveraging the Canadian Tire Centre parking lot once again?
And the answer is yes to both those. We are exploring the Canadian Tire Centre that we did use as for mass testing. That is an option, and we are looking at drive-in opportunities in perhaps 2 areas as well too. I want to caution, like we have currently, I believe we're going to have much more capacity than we will ever have vaccine as far as the rollout is concerned. But that said, we are building those reserve options for us. So I'd rather be in a position where we have a lot more vaccine and we can just turn all those options open. And so the answer to both those questions are yes, the team is looking at that right now.
Okay, amazing. Thank you. I'll leave it at that. Thank you very much.
Thank you, Councillor. Councillor El-Shantiri, I believe, is on the call.
Thank you, Mr.
Morning,
Chair.
Eli.
Good morning, Mr. Chair, and thank you to all my colleagues, and especially Dr. Etches and her team. I don't think we can ever say thank you enough. I know some of the questions I think Mr. Demonte has answered, because we talked about it in the past, and I think Councillor Dudas asked a similar question to the rural area where transportation or pharmacies or others not available. And I think during the flu clinic, we saw quite support for the mobile flu. So without putting words in your mouth, Mr. Demonte, I would assume that was a dry run for the big vaccination. Is that fair to say? We're still on target. Whenever that's available, we're going to go to those communities who is vulnerable with no transportation and far from any center.
Yes, Councillor, and you're absolutely right. The experience of the flu, the test site that we did was a great experience. So our mobile teams will pivot once they finish the long-term care and the retirement homes. They'll pivot to do two things. One, the vulnerable communities in the urban center, and and support that. But we have a plan in place to set up in the rural communities vaccination mobile clinics, and we may go to the next level with that. We're also exploring, as you know, in disasters that you've been able to help us manage in your community. We have those mass casualty incident tents. We have 3 of those. We may be setting those up attached to a community center. We have the paramedic mobile buses. So with nurses and paramedics and public health teams, we're looking at all those options, and they're ready to deploy. If we have to do it tomorrow morning, we could deploy them quite rapidly. But we'll actually be linking up with you and your rural colleagues to look at some of the areas where you think would be best. But we know we need a different strategy, and we have that in our planning for the rural communities because of the geography and what you've just described. Those communities would be disadvantages, so they won't have any disadvantage. We're going to get out there, and they'll be able to get the vaccine when those populations are able to get them.
Well, thank you very much, and it's good to hear that. Thank you, Mr. Chair. That's my question. Thank you.
Thank you, Councillor. Next is Councillor Gower.
Thank you. There's 2 things I wanted to ask about. One is about, I understand with testing, anyone could come into Ottawa for a test. You could live in Almont and get a test in Ottawa, and vice versa, that nobody would be barred. No Ontario resident would be barred from getting a test anywhere in Ontario. What about cross-jurisdiction vaccines? Could someone from Kemptville get a vaccine at the Sportsplex, or could someone from Ottawa head to Carleton Place for a vaccine? How's that going to work?
I thought you were going to ask me the question about Quebec, because we had that challenge initially with long-term care staff that live in Quebec and work in Ontario. And so we vaccinated them to protect our Ontario residents because they were working in our long-term care facilities. Yes, in theory, we have to remember that in very simple terms, to put it, the vaccine is a provincial asset. We have vaccine here in Ottawa, but it doesn't belong to Ottawa or to Ottawa Public Health. It belongs to the province of Ontario. And actually, as you know, the gaps that we were talking about and Dr. Etch just talked about, right now as we're doing our math, it is possible that the government of Ontario has to redeploy its vaccine to different areas to complete long-term care second doses. So the simple answer is yes. I would suspect, though, that each jurisdiction, I know each public health unit is working extremely diligently right now to set up their models in each of the areas. And I know Dr. Etches is in contact with certainly her colleagues that surround us on a regular basis. And I'm invited once a week to sit in with them too. So that would be something that if you have an OHIP card and you're a resident of Ontario, you certainly could go to any facility. I think that'll be perhaps the next question is, well, will that impact our dosage and the number? I think that'll be a small percentage because every public health unit is ramping up to be able to achieve similar goals as Ottawa. Yeah, somebody from another jurisdiction could come to Ottawa if they were at an OHIP card and get vaccinated. It's a provincial asset.
Okay, thank you. That was going to be my follow-up. How are the jurisdictions around us doing? But thank you for that. The other question I had was about, I guess, schools and teachers. Where teachers might fall in terms of essential workers or priority groups. Maybe another way to ask that would be, is vaccinations of teachers a factor in assessing when students can go back to school?
So I'll tell you where they are. They're in phase 2 with the essential workers. They've been identified, the province, in phase 2. So when we get to that phase, they are there. But I'll let Dr. Etches talk more broadly about her medical opinion about how that impacts schools and their return.
So we are not going to have any protection from the vaccine on a significant scale for many months. And there is no way we should wait for that protection for children to go back to school. The level of community transmission right now in Ottawa is similar to or lower now than it was at our peak in October when schools were open, and we managed that level of COVID in the schools. We saw limited transmission within schools, and so my goal is to ensure that our schools are opened as soon as possible, because we know there are harms being done right now. Schools closed, children and youth, parents, workplaces are not able to function as well when they don't have the support of children in place and schools in place for children. So I know there can be no connection between waiting for a vaccine and the plans to open schools.
So to reiterate now, schools are safe right now. It's not a matter of whether or not there are vaccines for teachers or students. That's not a question. That's not how you're determining at this point whether or not it's safe for kids to return to school.
I never use the word safe because we can never prevent COVID-19 completely from entering into schools. But what I feel confident about is that we can manage the COVID levels to decrease transmission within schools, just as we did in the fall. So my recommendation to open schools comes from seeing the decline in the percent of people testing positive, seeing the reproductive number coming down, seeing the rate of COVID in our community coming down, and knowing that our team is committed to support teachers and parents and schools and students to review and reinforce the infection prevention and control methods that keep that transmission low. So that starts with screening. We're actually asking parents right now, screen your children if they have symptoms like a fever or a cough, to make sure they're tested for COVID. That's the first step to keep COVID out of the schools. When people have symptoms, make sure it's not COVID. Then we are going to be asking grade 1 students and above to wear masks in school. So practicing that, role modeling that, helping children wear masks. And then we have as much distance as possible between students. We have the cohorting that creates small groups, that if there is somebody who tests positive, we only need to follow up with those who are in that cohort to ask those high-risk contacts to be excluded for the 14 days. That 14 days is the incubation period. And so by asking people to stay home for that period, we can stop ongoing further transmission. So these are the tools we will use, and it's not related to the vaccine availability.
Okay, thank you for clarifying. If I can stray just for a few seconds beyond vaccines, I was very disappointed last week that when the province gave an update on Ottawa's school openings, that there wasn't any information about what kind of criteria they're using to make those decisions, and also no indication as to whether when the school openings might be reevaluated. I also didn't really see an acknowledgement from the province of the significant mental health toll, economic toll that it's having on our community. And I was wondering, Dr. Etches, if you knew when there'd be another consideration by the province as to when Ottawa schools may or may not reopen. I think that would give a lot of comfort and assurance to residents to have some more information. I think a lot of parents are really feeling in the dark right now.
Well, we're having regular conversations with the province and conveying our confidence that we are ready to open the schools. And I believe they indicated they'd be looking at it weekly as well. So I hope to hear something from them this week.
Okay. Advocacy towards the province on this. Thank you.
Thank you. Councillor Kavanaugh, please.
Thank you very much. Lots of good questions already. I had a session this past week, and Dr. Malani, Deputy Chief of Health Officer, was there, and that was very, very helpful because many, many questions by residents. One of the questions that kept coming up was people who had different chronic conditions and where they placed on the list. And I think the more information about that, the better. Because it was all about individual situations. Like I have type 1 diabetes, I have type 2 diabetes. Will I get to go first? That kind of thing. Also, just how they let people know they're there and they're ready to get the vaccination. So, so still lots and lots of questions. Communication is so important, and we do it so well. So I'm very confident on that. But I'd like to just sort of ask a bit more about the communications of how people will know about exactly when they can start looking to get a vaccination.
So directly to your question about people with high-risk chronic healthcare conditions and their caregivers as well, they're included in phase 2. So as I remember, again, and we're only in phase 1 right now. That'll be phase 2. It's predicted for March. But again, it's going to depend on vaccine if that gets pushed off. And again, I just want to repeat, I think you're absolutely right, Councillor, that communications will be strategic there. Now, high-risk chronic healthcare conditions can be broad as well too, and there needs to be some work as to defining that. But that's where that category of group will be captured as well. And I know in your ward in particular, there's some high-rise buildings there with many elderly patients. We're looking at mobile strategies for them as well too. And the province also in phase 2 has tranches of patients 80 years and older will come first, and then 75 to 80, and then 70 to 75. So that is also part of the planning that's being looked. But unfortunately, that's still all in phase 2. We're not quite there yet. Dr. Etches, I don't know if you want to add anything about the high-risk chronic healthcare conditions and the discussions being had at the province to define that.
Well, I think they're looking at the science and the evidence around who is most likely to be infected and have serious infection when it comes to setting priorities.
Okay, thank you very much. And as you pointed out, Mr. Demonte, we have the highest number of seniors in the city, actually, probably in the province in Bay Ward. So lots of people asking, for their vaccination, the 80 over crowd. I think I've got a pretty good chunk of them, and they're all keen. It's good news. So I hope that we'll be able to have mobile clinics. So some of them have even written to me about having clinics for their condo building because of the ratio of the number of seniors in their building. And I appreciate that you've mentioned that, and so that can be looked into. One of the other things that I'm getting is people who want to volunteer to help, with some kind of medical background, maybe retired people. Will you be short of staff? Will that be something useful?
So currently, and maybe get into this too, because it may be questions some of your colleagues may have. We know for our 4 clinics that we're going to stand up, we're basically replicating what public health does really well every year for influenza. So they will be staffed by the public health team, those 4. We'll have 2 hospital clinics, which will be staffed by the hospitals as well, which are currently the Civic. And we're hoping to have an announcement of a second hospital clinic as well too. So the hospital staff will staff those. Our mobile clinics right now have been staffed by our paramedic team, and they'll continue to be able to do that. The 3 others that we're standing up as part of the process, when the healthcare workers in phase 1, we do all the healthcare workers, all the hospitals are going to vaccinate all their staff. Then they'll become available. Those hospitals that don't have clinics, we're going to be asking them to help us staff those other 2 or maybe 3 sites. And as well, it's always to have reserves in the background. Directly to your question, public health has already been doing outreach to physicians and nurses in the community as well too, to see if there was volunteers there as well to help us. So we'll even have that as a backup plan. So currently we're in good stead, and that work is being done. So I'm not worried about what we have planned. Some of the other stuff, if we want to do a massive vaccination and increase beyond 7, we may need, but that work's being done right now by the public health team, as a matter of fact.
Thank you. It kind of reminds me of during the flood. We had tons of volunteers. I'm finding the same atmosphere, that people want to help, especially those that have had the background for it, with some kind of medical background. So it's very refreshing to know. And if we have some direction for them, if we do happen to need them, that would be great. And it's always good to just know that they're out there if necessary. Okay. My other concern is vulnerable populations, and particularly families, because there's families that are large families, and that's been one of the issues, is that they're coexisting in one household. It's been hard to isolate. There's been a lot of issues, as Dr. Etches has pointed out. It's very difficult in general because lack of Wi-Fi, other things. And I'm wondering if there'll be a special outreach to those communities.
So I'll let Dr. Etches talk. Her team's already, as she mentioned, they're doing a lot of outreach to some of those communities. I mean, broadly, that group falls into phase 3 when, mass vaccination, pharmacies, all that are available. That said, there are specific populations that we're looking at that have been disproportionately impacted by COVID, racialized. Dr. Etches talked about, social demographics with regards to their economic capacity, and perhaps that's some of the people the families you're referring to. So we are looking at them in particular, but broadly, I mean, if they're not in the high risk or high elderly patients, they'll fall in the broad group of the general vaccination for the entire public, except for what I've just described. So we're going to be targeting some of those communities that are more racialized or have been more disproportionately impacted with maybe clinics there. And then the communication strategy, as I said, we have a public health team that does that every day and does it really well. So we'll be leaning a lot on that. I don't know, Dr. Etches, if you want to talk about some of the outreach you're already doing, but I'll leave it to you.
Well, for each population mentioned on the slides, we have networks of partners who work directly with communities at higher risk, and we're having the conversations about what barriers they see to immunization, how we can break down those barriers. We're looking at culturally appropriate messaging. We've already translated messaging into Somali, into Arabic, simplified Chinese, Spanish. So, this is something on our minds as well. As I mentioned, we are aiming to use the vaccination campaign to decrease inequities in who is being infected by COVID-19. And so even when we start with the population age groups mentioned for phase 2, we will be taking that lens of which communities are at higher risk.
Okay, thank you. This isn't totally related to the vaccines, but I hope we'll continue the message of staying healthy, because that's a concern when people are shut in for long periods of time, that they should still consider going out for a walk or getting a little bit of fresh air as long as they follow protocol. Without not talking about the extreme situations of tobogganing on crowded hills, but just to get outside and to follow protocol. So I appreciate all the work that OPH is doing on that. Thank you.
Thank you, Councillor. Councillor Shirelli.
Hi, Councillor Shirelli's not here, but this is Chantal from his office.
Yeah, Chantal, we're going to go through the councillors first, and then councillor staff. No problem. So we'll get back to you for sure. Thank you. I'm next. I don't particularly have any questions. I get pretty well briefed up on a regular basis. So thanks again to the two of you. Councillor Deans.
Thank you, Councillor Eglai, and to Dr. Etches and Mr. DeMonte and you, Councillor, and the entire team. I just want to add my thanks for the ongoing work you do. And I just want you to know that I feel like we're in really good hands in Ottawa. I feel confident that all of the work is being done to protect our citizens, and I really appreciate all of your efforts. I've been thinking a lot about the end. I know this is a marathon. It's definitely not a 100-yard dash. But I think as all of us continue to make sacrifices in our day-to-day lives, one of the things that we want to know is where the finish line is. Like, what will it take to get us to the place where maybe we can return to some semblance of normal in our daily lives? And, I think I don't really understand exactly where that line is. Is it herd immunity? I was really encouraged by what Dr. Etches said about in the ECHOS research, that 83% of our citizens are indicating a desire to get a vaccination. Does that get us where we need to go? Once the vaccine is available and 83% of our population gets that vaccine, does that get us across the finish line, or where is it? And do we have any projected timeline for what that looks like currently based on the availability of vaccine?
Great question. I would like to be able to be more specific, but I think you're right in terms of what we're trying to do is build up enough immunity in the population to decrease COVID transmission with the measures like masks and distancing needing to be in place for those many months. I'm saying like at least into the summer until we can get 60, 70 plus % of the population immunized. I can't be definitive about that number because we don't know yet. We have to evaluate as we go along the real world effectiveness of this vaccine or the vaccines. But we do expect that we'll reach that kind of population level coverage, 70-ish plus % by September. We are hoping that that will enable the population to be able to relax some of the things like having to always be concerned about 2 meters distance between each other. What I hope to see before then is that the protection being provided by the vaccine to older adults will decrease the pressures on our hospitals and decrease the deaths. I think that also, when that's achieved, when we see that we do not have the same level of hospitalizations, that is what's been a struggle. That's been behind a lot of the more strict measures to stay at home, is because our healthcare system has not been able to manage to do the work it needs to do with the level of hospitalizations and the backlog now that they're facing for chronic diseases like heart disease and cancer. So that is key, and we're watching that very carefully. Again, I don't know yet when we will start to see that population level protection be high enough to be able to say, okay, our hospital, our healthcare system is going to be fine. But if we look at the phasing from the province right now, starting with people over 80, over 75, over 70 in March to through to July, to go through those age groups, that should make a difference. So by the summer, I'm hoping all of those older adults who are at greatest risk will be able to see some impact there.
So are our goals more local or global right now, in your opinion?
Around the world, usually the goals are the same for the pandemic response. It's to decrease hospitalizations and death and to minimize societal disruption. So what that means locally, it's the same. We want to see a decrease in hospitalizations and death, and we want to be able to resume the services and the activities that enable our society to function. And so, the people of Ottawa showed that they could live with COVID at manageable levels in the fall. I think we can get back to that sooner rather than later. So we should be able to live with COVID, within weeks to months, if we continue bringing down the COVID levels with masks and with distancing. So it's not dependent on vaccination. We can bring the levels lower that allow us to open schools, that allow us to have businesses more open, as we did in the fall. But the more we use the tools like masks and distancing, the better off we'll be sooner.
Okay, thank you for that. Because I think we all need to know that we're getting there. Like, we're moving in the direction, like all of the sacrifices that individuals are making in terms of doing their part as a citizen to get us to the finish line. We need to know that it's advancing and we are getting there, because sometimes the isolation can be hard. And I think if you see the progress, and maybe if I have a message for public health, it's like maybe chart the progress a little bit, like give us some indication of how we're doing, more frequently, so we can feel that we're getting there. Because you need to the tunnel is long, so I think we just need some encouragement. But I think there are a lot of encouraging signs right now, and I really do appreciate your work. I just have a couple questions about those extra 3 community clinics. How will you determine the locations for those? I mean, obviously, all members of council want to see some geographic spreading of those, so that they're in places where populations can most access them. So, what are the criteria for determining where they will be?
So the next 3 that we're looking at are very much looking at targeting the communities that have been more disproportionately impacted by COVID. So definitely 2 of those will be in those communities. And then the third, again, will be the same thing. And then the options that were brought up, like whether we have a drive-through or a broader big mass vaccination site, if ever we had that vaccine capacity. I mean, I don't see a scenario right now that will have that kind of volume, but those will just be geographically dispersed. But so directly to your question, those 3 are we're looking at. That's why we did 4 kind of geographically city buildings, and the other 3 are based on the work that Dr. Etches and the team have done. We're analyzing where people were disproportionately impacted, and that's what we're looking at, those areas, to find buildings also that meet these provincial criteria that I talked about. There's very strict criteria about what they got to look like and the size and the way we got to set them up. So that's where those other ones will be targeted. And then that may not be enough, Councillor. So we have also the mobile option that we could also set up a mobile site in a community that doesn't have a building, doesn't have an option, but we've identified as disproportionately impacted or racialized or whatever. We're going to set up a mobile clinic there.
Okay, I like that. When will we know about the 3 clinic locations?
The facilities task force is currently working with looking at that right now. I suspect in the next week or so we'll have that ready. As you can understand, that'll probably be only for phase 3, so it's still far off. So as we prioritize our work to get everything ready now, that's a little further off. But I suspect in a week or 2 we'll get an idea. And as soon as we've locked that down, like we've done it, it'll be transparent in one of the memos to council. We'll let you know right away.
Okay, thank you for that, Mr. DeMonte. And you mentioned that the province's online booking system. Of course, we all know that there is a portion of the population that don't use online tools. So what strategies are they putting in place to ensure that everyone has access?
So as we do with our immunization clinics, as we do with other things, our 311, not everybody uses online to ask for city services. The phone will also be an option. And then so that's being looked at. And as well, I thought you were going down the path, because I know you've had experience with provincial IT systems that haven't been always worked well. Our IT team actually is very positive about what they're doing, but we also we're looking at even a local backup system. So as emergency planning always does, you have a backup to a backup. If ever something failed, we have a local system that we could stand up here in Ottawa to continue and not delay any of our vaccines. So that's part of the planning team is doing that work as well too.
Okay, those are all my questions. Thank you again very much.
Thank you. Councillor Tierney, please.
Great. Thank you very much, Keith. And a big thanks to everyone at OPH and Tony. You guys are doing a tremendous job. And I want to thank Ottawa Public Health for trying to stomp out, you probably can't see this, but it's one of those anti-vaxxer misinformation pieces of information that are floating around the neighborhood. So we really appreciate all the communications you provided us. I just have a few questions. First, local businesses, I'm getting some emails where there's confusion about when a possible reopening could be. Is it the 11th? Is it the 19th? Our numbers are all down to 32 now. Do we have any indication when we could be entering back into restaurant dining, haircuts, all that sort of stuff again?
No, those decisions are made by the province. Mm-hmm. We are suggesting that schools open as a first step, and we look at the impact of that and monitor the impact of the stay-at-home order. And then, the conversations will turn to what that means. Under the provincial framework, I think we still don't have confirmation that they're going to return to that provincial framework, the color-coded, the different thresholds that were in place before the lockdowns. So I think we need to to get more clarity from the provincial level on that.
Yeah, I think that's a critical thing for our local business for sure. When it comes to, I share very similar concerns on the provincial software. I mean, we're almost at a year now. I think people have had enough time to get their heads around this whole thing. Is this a software being created by the provincial government? Are they purchasing it? I mean, those are two very different worlds. And I'm just wondering, is this something that's just stretching across all 444 municipalities? There's just some confusion on what this actually is.
Right. So we currently have a tool. There's a tool currently being used right now, and it's it's been adapted and adjusted, and it's actually fairly effective. I don't know if you recall, but last week they had stood up a mass vaccination site as a pilot in Toronto, the Toronto Metro Toronto Center. It had to unfortunately shut down because of the announcement that we weren't getting vaccine. But that's where they were testing their product. And my understanding from my colleague Matt Pegg, who I talk to regularly and on the calls with the general, it went really well. So the IT solution is not only being built, it's built and is being tested and adjusted accordingly. So those are encouraging signs, and we'll see. But again, as I mentioned, in emergency planning, we always have to have a plan B. So we have a plan B locally with the tool. But so no, I have no hesitation right now to think that we won't have a provincial tool. And I think it's important to understand, people saying, well, why do we need a provincial tool? It's important to understand as the province to understand the dynamic of how much vaccines being given, where it's being given, what gaps there may be. This is a tool that all that information is provided from a logistics standpoint to understand where the gaps may be and what they need to adjust, and in real time. The more scientific side too, it provides a lot of information to achieve some of the milestones and the goals that we want to achieve, as Dr. Etches said, of those priority groups where the deaths and the extreme cases of being impacted by COVID, that we're achieving those priorities. So it's important to have a provincial system. So that's underway, and actually I'm encouraged by what I'm hearing.
Well, if you're encouraged, I'm certainly encouraged. Oh, sorry, Vera.
Oh, yeah, the system for recording all of the doses is called COVAX, and it is being worked on all the time to add functionality. The piece about being able to assess uptake of vaccine by population at higher risk is uneven right now. We know the province is working on being able to collect elements like income and ethnicity. We are moving ahead with that, as we did with case and contact management first, using a paper-based parallel system to be able to assess, what is the uptake of vaccine among different populations, whether newcomers or Black, for example, low income. So it is important for the population to have this kind of information, and I know the province is working on adding that in.
Okay, great. Thank you very much for that. Just a couple of quick last ones. I'm getting a lot of feedback from daycare workers. Do we know where they would fit in? Are they at level 2, I guess, or phase 2, you want to call it? Or are they further down the chain?
I believe that, and again, as Dr. Etches said, there's still work being done at the provincial level, but the discussions I had heard is they would fall in phase 2 in the essential workers. But that has not yet been confirmed. There's still some clarity that's required about clearly defining each of those essential workers, and everybody obviously wants to be in the essential worker definition, but there's work still being done there. I don't know if Dr. Etches has heard anything different recently.
They are essential workers, like teachers are essential workers. I think the more challenging part is how we roll out the vaccine to so many essential workers all at once. And, that's where I think we still need to use the age filter. So people will be at higher risk for hospitalizations and death based on their age as the most important factor.
Great, thank you. When it comes to actually delivering the product to a long-term care home to be able to do the vaccinations, obviously you can never get it precisely correct. So you might have some extra doses. Have we, first of all, wasted any doses? And second, if it's not a worker or a resident, are you guys actively going out and trying to get somebody else vaccinated to avoid waste?
Yeah, that's a very good question. So the direct answer is there has been no wastage of any of the vaccine, either in our mobile model or even in the hospital clinic model. We do actually have a plan, and this is a little bit of inside information. The vials, you know, you're supposed to get so many vaccines out of one vial. And at the beginning, it appeared that the way that was prepared, you could get a couple of more vaccines on occasion out of a certain vial. So at the end of the day, you could have a dozen or so extra vaccines. So when it was in the hospital, they had a standing list of criteria of healthcare workers that were in the group that needed to be vaccinated. It wasn't given to an administrator or anyone else. So, you know, doctors or nurses that worked in the emergency department, the ICU, or in a COVID ward would be called down. They were kind of on standby at the end of the day. You kind of knew half an hour before the end of the day, I think we're going to, because you knew how many more patients were coming in. You knew how many you would have left over. So you'd call those people down to use that. And when we did the long-term care facilities, we did the same thing. So in those cases, other workers that were in the criteria and defined, so perhaps a paramedic could get it or something like that. So there was never any waste, and it wasn't given to anybody that wasn't in the priority groups that had been identified, and that continues to be our model.
Okay, thank you for that. And a real last question, just curious about when it talks about mass gatherings, and you know, just based on some of the math I'm seeing, it's going to be like end of September before we even get anywhere. But have we, and this might be more for the city manager than this group here, from bookings of events and things like that. Have we had input from you guys to say don't book any events till X date so far?
So just to give you a bit of understanding, part of the organizational structure that we did, that's why this group answers to the emergency operations group, which is chaired by the city manager and all the departments. We haven't had that direct discussion because we're currently still in lockdown. We haven't started looking at when, was, I guess, a bit of discussion Dr. Etch has had, and Councillor Dean's asked as well, when do we think we're going to be? I don't think we're going to see that for some time, and we're not going to be contemplating that discussion yet for some time. I think it'll be late summer before we start having those discussions as to, is there a possibility from a medical standpoint that we could start reopening those things? So I would say to you, Councillor, is we haven't had those discussions yet because I think it's very, very premature, and we're looking at late summer before we even start thinking of having those discussions.
Yeah, and Tony, you're totally correct. It's just more from the administrative point of view. I'm just wondering, and I'll have to check with our city manager on that instead, is are we actually booking events for things that we in turn will have to cancel later on? I prefer just to be honest with people and say, don't bother booking. There's administrative overhead back and forth. There's no point. We're not going to have a Canada Day event. Yeah,
no, currently I can tell you we're not booking events in city venues until we get closer. That Dan and his team are not doing that.
Wonderful. Thank you so much. Great work, team.
Thank you. Next on the list is Councillor Fleury, please.
Merci, Monsieur le Président. Bonjour, chef. Bonjour, docteur. Merci de votre temps ce matin. J'espère que vous pouvez respirer puis prendre un verre d'eau. J'ai quelques questions pour vous. Puis, premièrement, merci beaucoup du temps hier aussi. J'ai apprécié. J'avais soumis quelques questions suite à votre mémo. Puis, j'apprécie votre temps. Premièrement, peut-être d'une façon plus macro, là, ça fait plusieurs mois qu'on a mis en place le modèle de testing pour la COVID. Quelles ont été les mesures qu'on a apprises? Parce qu'à un moment donné, quelqu'un va faire une analyse d'où on a débuté puis où on a fini, que ce soit la mise en œuvre du site à l'est, que ce soit la mise en œuvre du site dans le quartier Overbrook, maintenant le site de dépistage dans Vanier où les gens peuvent marcher. Donc, qu'est-ce qu'on a appris de la période de testing de COVID, puis comment on transfère cette information-là pour les sites de vaccination?
Je vais peut-être commencer. Dr. Etches peut rajouter au niveau médical si elle veut. C'est clair que ces expériences-là nous donnent toujours de la capacité de valider des choses, des concepts qu'on avait mis en place qui ont été validés ou on a réalisé qu'ils n'ont pas fonctionné. Particulièrement dans l'Est, lorsqu'on a modifié le centre Ray Friel pour devenir un centre, il est clair que ce centre-là qui a été modifié peut être un centre qui ultimement peut être changé à pas un centre de testing, mais un centre de vaccination. Donc, ces expériences-là sont valides. Par rapport à les éléments qui étaient à l'extérieur du contrôle de la municipalité, par exemple, les délais, le problème qu'on a eu au niveau, que les hôpitaux ont eu au niveau de la prise en charge des gens pour les examens, etc. Ces expériences-là ont été transmises et la province sont en train de s'ajuster en fonction de ça. Donc, je peux vous dire, c'est toujours des expériences, comme vous dites, importantes d'analyser, de dire, bon, comment qu'on ne répète pas les expériences négatives et comment qu'on bâtit sur les expériences positives. Et c'est clair que l'équipe sont en train de faire ça actuellement.
On parlait...
Oui, je m'excuse. Je peux juste ajouter qu'un point aussi important que nous avons à prendre appris, je m'excuse, nous avons
that we have learned is that it's important to have community engagement. We started with an access point. We created an access point for contact tracing, but people haven't been using it. So we have to work with the community to see what protective measures work. And then we also had to create access point sites. Thank you. All excuses, of course, are good for anybody who wants I'm certainly going to roll up my sleeve at the first opportunity. And then some people, of course, are more reticent. So you've implemented a structure and you're aware of the equity issue.
Sites identifiés. Moi, des 4 sites, il n'y en a aucun que je trouve accessible pour
There are 4 sites that have been identified for vaccination, but none of them are adequate in my sense to address the issue of racial inequality. When we look at mobile sites, for example, you said 10,800 vaccines per day possibility. So that means 200 vaccines per mobile site. So how are you going to implement the objectives that you have in terms of equity? I think that we should have a site that's accessible through the light rail system. I'm thinking of the Shaw Center that could be used as a mass vaccination site. I'm going to start with Dr. Etches. I'll start first. So the 4 sites that were established were based on existing flu vaccination clinics. Yes, for the annual flu. So these sites were already being used for that purpose, and we converted them very quickly and efficiently. And if we had had an abundance of vaccine supply, we could have pivoted and used these sites, the flu vaccine sites. Now, you're talking about phase 2. We're not so of the 3 sites that are going to be put online, 2 are going to be dedicated to areas where we have racialized communities, poor districts, people who've been impacted more heavily by COVID-19. So at least 2 of these sites are going to be targeting those. And yes, you're talking about mass vaccination sites like the Shaw Center. It's also an option that we're looking at. It's under study right now. As concerns mobile clinics, the advantage of mobile clinics is that provincial regulation for the creation of a site is very rigorous. And very often, when we go into an area, we can't find a building that is appropriate and that can meet all the criteria and requirements set out by provincial regulation. So a mobile site, of course, can be brought in. in your neighborhood in Vanier, for example, and it can be set up. So even if there's no appropriate building, we can still carry out the vaccination program. So we're not rejecting what you're saying, but we're working at all these options right now, including the other idea from your colleague, which is a drive-through clinic, and that's a very different problematic, of course, because of course people who use the drive-through need a car. So all these options are being investigated. So we have to get ready for phase 2. But right now we're talking about phase 3. That's where we look at the mass vaccination programs. Dr. Etches, if you have anything to add. The only point that I would like to add is that
the uptake across different communities at higher risk in real time, and we will adjust our approach if it looks like we are not achieving those goals of equity.
Final few questions here. We are in the first phase. We have a kind of a startup crunch that we're waiting for clarity on the numbers and getting a flow. And I can only appreciate the challenges that the various teams have had. At the point where we get into the mass vaccination of the public, Tony was speaking about a space like the Shaw or other that could really be utilized. At that point, would we consider 24/7? I would hate that, people have different lifestyles, they work different hours. There's always a reason not to be vaccinated, and I wouldn't want a factor of time to be that. At the same time, we've heard on local news sources, physicians and health professionals say, hey, after my shift, if I can go and give 2-3 hours shift for vaccination, I'll certainly do it until everyone's vaccinated. So how are we setting that up? Because I love that energy from our health professionals. I'm not surprised by it. And I think we have to tap into that.
Yeah. So directly to your question, yeah, both options are being looked at. One for the health professionals that are volunteering. I know there's a pent-up sense of, well, I haven't been called yet because it is phase 3, but public health has already done that outreach, and we're compiling that information. With regards to 24/7, yes, we haven't taken that off the plate. On the contrary, we're going to explore that. I'm only, and I'm not being pessimistic, I don't know if we'll ever be in a position we'll have such stock available to run something 24/7, but certainly we're looking at that, and we're going to plan to at least have one of those sites capable of being 24/7. I think to your earlier question and to this one, and Dr. Ench has mentioned it too, as we do in real-time analysis, our plan is designed to be able to ramp up if we require it or ramp down when we don't have vaccine. It's all dependent on vaccine. So directly to your question, if we get tons of vaccine and the demand is there, we can ramp up, including having 24/7 options. So absolutely, it's not all being explored. It's part of the planning that we're doing.
And if I'm a retired health worker waiting at home, able to give vaccines, where should I go at this point?
Yeah, so Dr. Etches' team, and I'll let her talk to this more particularly, has done a reach to those who are currently, and you'll have to understand, it's still a medical delegated act to be able to put so retired means that, you're no longer a member of your college, you're not paying, so that may be more complex. We're looking at those, what you've just described, after their shift that are ready to give extra time. We're currently in very good stead with regards to what we have as far as capacity of vaccinators, if I could use that term. If we set everything up, if we go beyond that, yes, then we'd have to look at those pools. But we would look. The first pool would be those who are currently practicing and have a license with their professional college as a first, before we go to retired or even students. That could be another option too. But I don't know, Dr. Etches, if you want to add anything to that, because I know that her team has been working really hard on that right now.
Yes, so people can always contact Ottawa Public Health, and we'll take in lists of people that are interested. There is no question that this eventually will turn into something that involves all the primary care vaccinators, all the pharmacies that we can use, just like we do in the annual influenza immunization clinic. So those days will come when we will use all of the people who typically give vaccines.
Okay, the final one for me is Ottawa as a capital city has embassies, and we know that the variant's been found now in our region, a new variant. So what is our embassy strategy? We have a lot of folks that are traveling for work that are coming. How do we make sure that they're quarantined? How do we make sure that they're part of the vaccination? We talked about this is not about getting ahead of everyone. It's about everyone getting vaccinated. And how do we get there with a large population of embassy, even local staff that work in embassies, with consulates that travel out of country? So can we clarify, have we put some thought into that particular element?
Well, I'll talk about first. Those who work would be all captured. They're all residents of Ontario. They have OHIP cards. They would be captured in our vaccination strategy. With regards to diplomats and that as well too, there's options for them as well too to participate. With regard to international travel, I mean, Dr. Etches can talk about how she feels about that. But again, that's a responsibility that belongs to the federal government about who's allowed to travel, who's not allowed to travel. You've talked about a very elite group that have options that the rest of us may not have, diplomats that need to travel back to their home countries, etc. So I know they are traveling, but those rules of quarantine apply to them upon their return, etc. And that is enforced by the federal government. But Dr. Etches perhaps can give us more of her sense of what her expectations are of that community.
That is correct. The expectations are the same for quarantine, meaning that people do not leave their homes for 14 days after traveling. And we reinforce that. If somebody is tested and test positive, we reinforce and monitor that people are self-isolating.
Thank you for your time. Appreciate it.
Thank you very much. And Councillor King is next.
Thank you, Chair. And I'd like to thank OPH for all the work that it's doing. I'm very impressed with the thought, especially that's being put into logistics by Ottawa Public Health in the city. I know in other jurisdictions we've heard about challenges in terms of delivering vaccine in the early stages, of delivering that to long-term care facilities, as well as to the people who work in them, challenges ensuring that people get the same dosage of both the Pfizer vaccine and the Moderna vaccine in the two-stage approach. So I'm happy that thought is being put to this. I do echo my colleague, Councillor Fleury's concerns about a more central location or more central locations for immunization. That would be accessible by multiple modes of transportation, including active transportation, because in the last round with testing at facilities, we had heard about challenges, especially for lower income communities, residents there who have to travel long distances, often with children, to get tested. So we want to ensure that there is closer proximity of vaccination clinics to our residents, especially in low income and racialized communities. But I would like to commend OPH for the work that it's undertaking with many community developers working within OPH's Healthy Communities team to support communities, especially in my own, with outreach. Public health nurses, along with your community developers, have been going door to door, checking on vulnerable members of the community. And I had the pleasure of going out with them during December before stay-at-home measures were declared in the province. And an excellent job is being done by staff. But while we are slowly building trust in racialized communities with these types of processes, we also know that vaccine hesitancy is going to be one of the biggest roadblocks to getting critical herd immunity in our community. Many members of racialized and lower income communities have a deep mistrust of government, and there has been a lot of misinformation that has been circulating, especially in the first days of the pandemic. I actually was subject to some of them in some of the community forums that I witnessed. So, you know, we're noting that there is hesitancy. You have spoken to it, and I'm just curious if you can provide a little bit more detail on the overall plan to combat vaccine hesitancy as we ramp up through 2021?
So we're using multiple tactics. Social media is one. We've heard from communities at higher risk that WhatsApp is a useful tool to communicate. And so we have established new WhatsApp addresses. Actually, addresses might not even be the correct word. Sorry, my team is more involved in this than I am. In multiple languages. So we've established new channels in Somali, in Arabic to convey messages, and we're doing that with spokespeople from those communities. So it's not me at all. The trust and confidence will come from talking to people who are known and experts and leaders in the community. And so this is a key avenue to share information. We're working with faith leaders, for example, as well. We know that there's a lot to be gained from working with faith communities to share messages. Right now, we give key messages, updates on the situation, information that people might need, and it will come to when you can get your vaccine, where that is, to the Muslim community on Fridays, so that can be shared before and during evening Friday prayers. So there are many different channels, and I appreciate counselors also are key leaders in your communities, and so we'll continue to provide you with tools to share good information and direct people to Ottawa Public Health Resources or Health Canada. Our ECOS survey, again, it showed actually most people, a high percentage of people in Ottawa are planning to be vaccinated, but it also underlined the place people feel is the most credible source of information is Health Canada. And so I recommend we continue to use that. That is appropriate. And then, Ottawa Public Health was listed as well as a credible source. So we'll appreciate that we need to monitor this again. If we're seeing particular challenges arise or myths arise, we will counter those myths directly.
Thank you for that. And just one quick question, wonderful direct engagement with community members. So I actually observed that in December. I'm just wondering, how will that be integrated with the vaccination efforts in low income or racialized communities? So, we have a very good thing going with being able to knock on doors and really do that outreach. I'm just wondering how that outreach will be integrated into potentially mobile vaccination efforts.
It will depend on which vaccines we have to use. So Mr. Demonte has described mobile options, also roving options, where we would set up shop in a community at higher risk for a while until there's more vaccine coverage if needed. Taking vaccine door to door is not necessarily the first strategy, but we do see building to building may well be possible, and we need to think about all the infection prevention and control practices that need to be in place. We're living in the time of COVID, so it's not quite the same as flu campaign in that regard in other years, but we did just come through an influenza campaign again where we had higher coverage than ever. We will use those practices, and so built right into the system for running the vaccine program that Mr. Demonte mentioned is a community engagement table, is a sequencing task force, both of which are established specifically to hear from communities and to be guided by communities, to inform the overall process in terms of addressing barriers, promoting vaccine uptake, and doing it in an equitable way.
I appreciate that. Appreciate all the hard work that OPH is doing in our communities to the benefit of all of our wards and the entire city. Thank you, Chair.
Thank you. Councillor McKenney, please. I believe you're still on the call. There you are.
Thank you. Thank you, Dr. Etches and Tony and everyone for the briefing. Of course, this was very helpful. For all the work that you've been doing, I can't imagine over the last 10 months. I just, a few questions. Obviously, many have been answered. Thank you for that. When we talk about going into congregate settings, I just want to clarify that rooming houses would be included in that congregate setting. And I trust that they are. And how do you see that rolling out? Like, how do you see that progressing through the rooming houses? All rooming houses are not equal either. Some of them are horrifically challenged in terms of living standards, and others function quite well, but there still are congregate living settings. So I just wonder how that will be managed, and will it be managed in the same stage as our homeless population?
So I'll start, and Dr. Etches can add. So they are in phase 2 with regards to the risk factor. So they're part of that. Absolutely, we're looking at different strategies. Some of those people living in those settings may still wish to go to the local pharmacy, go to their physician, and that's fine as well too. What we're going to do is we're going to take a lot of public health data, and we're going to overlap that to see some of the challenges in those areas. And we're going to use multiple strategies. As I said, they could go to pharmacies, they go to their physician, or we could have a mobile team go in there. Dr. Etches indicated earlier, the challenge with one-to-one mobile is then you have infection control, you have all those other challenges. And obviously, it's the whole macro, try to get as many people vaccinated as quickly as possible. When we use energy and resources for just one-on-ones, it becomes more complicated for us, but it's something that we are planning, and that may take a little bit more time to get through, as that, not like our long-term care, we went in and in a very short amount of time we're able to do all of them. But it's something that we're working on. I don't know, Vera, if you have anything else you wanted to add to that particular group.
Just again to say, in the flu season, we do outreach immunization, and we did this year relying on our partners like Inner City Health and also the Red Cross. So we would use those same methods.
Okay. I'd also suggest, obviously, the community health resource centers.
Yep.
In my ward, for example, Somerset West sees
right.
a lot of people through the supervised consumption service, and just being able to use that model in that way of reaching people who are really hard to reach and move about. And I guess that brings me to my second question around this population, the population experiencing homelessness. I know that we've got, the overflow sites and the isolation centers, and things are, our large shelters are managed very well. But how do we anticipate, for people who are not in shelter, they're sleeping outside? I'm not sure what the number is today in this temperature, but it has been up to 200. How do you see that being managed in terms of not just the first vaccine, but as important, the second vaccine and on that, if I could just ask, like, are we going to use that approach to start thinking about identifying who people are who are experiencing homelessness, where they are, what services they're reaching out for? I mean, we do these point in time counts once every few years, and I've always been critical of them. I've always thought we need a by name list, and this just seems like such a good opportunity to start to create that by name list and understand. And it's happening in the respite centers, which people who use them actually call them the respect centers, because they say it's the first time in their lives they felt like we really respect who they are, and we really know who they are, and we care about whether they're going to come back the next day. So I just put that out there of if that thinking is being done, and suggesting that it is an approach that we can use. It's an opportunity we have to better understand our population of people experiencing homelessness.
Thank you, Councillor. I will take this back to the team. You've mentioned the community health centers, and that is a team that we're working with. The Ottawa Health team is, involves public health, the Ottawa Hospital, Briere, community health centers, and others. And we are also relying on inner city health, where we actually do have a mechanism to create records by name, health records by name for people who are homeless and supported by the shelter system and beyond, in respite centers or on the street. So I will flag this input and see what our healthcare system and social service system partners can do to make the most of this opportunity.
Okay, no, I appreciate that, because I really do. I see opportunity in this the same way as, the model that we've set up in the respite center. I think is critical to continue to ensure that we're, reaching this population. Last question, and it's more around, and I do want to, I just want to reiterate what Councillor King and Fleury said, like in terms of our approach to vaccination and the model we're using to reach people. Last time Ottawa Hospital was very late in bringing testing into the downtown for low-income communities and individuals and families and households without a vehicle. So I just want to reiterate that, so that it's not something that we are back here, asking for, when it's getting late. So I just want to reiterate that. I know you've heard it. My very last question is on surveillance and contact tracing today. Are we still going into high-risk communities and doing surveillance testing in the shelters, in other congregate settings? And what's happening with our contact tracing today? Are we with the numbers coming down? I noted that there's 32 today, so that's good. We're a fortunate population. We don't have those big manufacturing centers and those distribution centers that like Peel Region and Toronto have. So we don't have the workers who are getting sick because there's no paid sick days for them, sending them back to work. We're a more fortunate population overall, so we can bring our numbers down. But contact tracing, I think, is key to keeping them down and making sure that our schools are safe and our businesses can open. So just wonder.
Sure. On the case and contact management, Ottawa Public Health is maintaining the practice of following up with everybody who tests positive and their contacts. We had a backlog in terms of the full investigation for everybody within the time period we would like. We're trying to follow up with everyone within 24 hours to do that full investigation and intake. Right now, we're catching up from when there was a surge after the holidays, but we are still meeting the majority, everyone still gets that first phone call from us to do a risk assessment and basically triaging and making sure that people have what they need to be able to self-isolate. So we're doing those calls in time, assessing that people are supported to be staying at home, and rating the level of risk to do the follow-up based on risk. So if it's a school-age child, we do that as a priority. If it's somebody who works in a congregate care setting, we do that as a priority. If it's a family member where the contacts are household members only, it's not linked to a higher risk population, those people are waiting to hear from us for that full investigation. We are asking them to, of course, do the measures they can themselves to let people know if they're close contacts to self-isolate. But yeah, that backlog is clearing, and so the surveillance testing also, it is occurring where there's a rationale to better investigate what's happening in a congregate care setting, or a workplace. So if we have one person test positive in a congregate care setting, then our team often indicates, we should do that surveillance testing for everyone in the facility or institution or workplace. And so right now, the ministry, the provincial direction is to really continue that surveillance testing in long-term care homes as the top priority. But we do apply that where needed in other congregate settings.
And sorry.
Yeah, just one very quick question, just something that came up that you were speaking to, Dr. Etches. When you're doing contact tracing, are you hearing from people who aren't able to stay home because they don't have access to, paid sick days? Like, are you hearing that people are having struggles being able to isolate for
Our
14
team
days?
definitely, yeah, our team definitely hears about situations that are very challenging for families, where they are concerned about being able to purchase food to feed their families or have enough income to pay their rent. These are real situations that are faced every day. Also, childcare is a challenge. So if a parent is ill, being able to have that parent isolate when they're the caregiver is a challenge. So we have a voluntary isolation center, which is free room and board for the period of self-isolation, but there are even barriers for people to use that center if they still need to provide childcare, etc. So there are people having to make impossible choices, and we are very much thankful for the City of Ottawa's Human Needs Task Force, which continues to problem solve for families. Also, again, you mentioned the community health centers are playing a lead role in we have a system for referrals for greater supports for people who have tested positive and identify these challenges. We've made, I think now hundreds of referrals. So these are people with absolutely dire needs, and they're in the hundreds. So that is a system that it gives people more support for primary health care as well as social services.
Thank you, I appreciate it.
Councillor, I'd be remiss. I just want to repeat. I've heard you loud and clear, the same thing that Councillor King and Councillor Fleury, and I suspect Councillor Leeper and Councillor Menard would tell me the same thing about the urban core. So we'll look at that. But I want to just reiterate the advantage of the urban core versus some of the challenges we have in suburban and rural areas, and each have their needs, and we have to adapt accordingly. And I'm not saying that we won't look at we are going to look at it directly. The pharmacy is a big part of the strategy, which at least we're blessed in the urban core to have that as an option as well too. And it is part
absolutely
of the,
absolutely. And I don't want it to be one at the expense of another.
No. And neither do I.
I certainly understand the challenges of the rural areas and the outlying areas. Absolutely. But,
yeah. No, I appreciate your comment though. Thank you.
Okay. Thank you. Thanks, Chair.
Thank you. I note it's getting close to noon, and I know a number of councillors who haven't spoken yet are on either planning or ARAC. So I'm going to shift around a little bit to get to those councillors first. And accordingly, either way, Councillor Leeper is next. So we'll go, and then we'll go to the other members if that's all right with everybody who are on one of those two committees, and then go to the balance of the councillors after that. Okay, over to you, Jeff.
Thanks, Keith. Chief Demonte, certainly I have to reiterate what Councillors King, Fleury, you've heard us. It is important that folks who don't have a car are able to get a vaccination. But my key question is around our preparedness. Several weeks ago, you identified for us the potential need to second as many as several dozens of city employees to the vaccination effort. The last time we spoke, you were still identifying who those folks might be. Do those staff yet know who they are? What tasks they'll be undertaking? Are they being trained for that? And what are the impacts to other city services?
Yeah, so I know we had a quick chat about that. So the task force is looking at redeploying it. A lot of it is going to be for the centers, as you've indicated, and it'll be staff that'll have roles for crowd control, security, clerical work that needs to be done. We've, from our previous experience, and we're learning for almost every vaccinator, for every 2 vaccinators, you need 1 clerical staff because of the processes that need to be done. So that's what we're looking at. So the answer directly is no. I can't tell you individual X in the city knows they're going there, but when they do go, and what we've done previously is there is a training program for them. They are assigned. A lot of the staff to date that's been reassigned to support public health on a lot of their efforts, and it'll be very similar to this, have come from our Parks and Recs team and Dan's team, because a lot of those services have been shut down. And to your point exactly, so because those services are shut down, it doesn't have an impact right now on the community. That'll probably shift eventually as we start giving more vaccinations, and maybe Dr. Etches and others say we can start reopening parts of the economy. So that's being looked at, and that all bubbles up to the emergency operations control group that Steve Kay kind of leads. And we're currently looking at the impacts of what it has for city services. As you know, right now, basically we're status quo. A lot of the city services that have been shut down are remaining like that because of what we're doing. So it's not having much impact on city services. So directly to your question, we're starting to get a handle on exactly the number of what that represents based on the number of sites that we're open. So if it's 4 sites, we kind of know. If it goes to 7, if we have a mass vaccination site, then that increase. So that math and that work is all being done. I don't have that at the tips of our fingers. We haven't completed all that work, but it's something we're doing. So we're doing the first part as to what do we need? Who do we move over? And then once we know that, then we'll be able to do your other part of the question, which is important. What impacts does it have on the city services? Because those staff are away. But as I said, we're taking it from areas that are already shut down, for lack of a better term, of city services to put there to not impact the other services that are still running. And so I hope that helps you kind of get an understanding of the work that's being done.
It does. I've raised this maybe a couple of times now. The luxury of time is running out on that. If we start receiving thousands of doses per week within the next couple of months, we're going to need to have those staff on the ground, because I'm concerned about the potential for, even a week's delay in taking advantage of vaccination capacity. So I will continue to ask you about that, because I want to make sure that as soon as the doses are available, the staff are available. But thank you very much for the incredible work that you've done so far. I do feel very confident that when the time comes, the city will be ready. Thanks, Chair Eglay.
Thank you very much. Councillor Barakini, I believe, is also on planning, but also next on the list. So over to you.
Thanks, Chair. And really good presentation today. Thank you. We need more, not less. And really good questions from my colleagues. I'm troubled that our neighbors to the south in Q1 are expected to receive 120 million doses of the vaccine. The Guardian newspaper and now the CBC today report that the EU are planning to block exports of vaccine to other markets because they want to preserve for themselves. Who is advocating for the city of Ottawa, to the federal government, to the provincial government, to acquire as many vaccines as possible? I think the feds, when they ordered the vaccine last year, did really well. They threw the net out wide. They bought many. There didn't seem to be a delivery plan attached to that. We saw vaccination stop over the Christmas holiday, despite having vaccines in our hands, in our shelves in Ontario. Who is approaching the other levels of government saying, look, guys, we need you to do everything possible to get as many vaccines in Canada, in Ontario, in Ottawa? Who's doing that? Is the city manager doing that? Is the mayor? Is Dr. Etches? Who's doing this advocacy?
Mr. DeMonte Pazzi, but I certainly have conversations with MPPs and with MPs, and we do talk about supply as the limiting factor in terms of us being able to, run a vaccination campaign that protects the population. So, I do think they're aware that we would welcome more supply.
Yeah, I would just add, Councillor, that I sit on a daily brief with the general and the provincial team, and while it's not my role to advocate to other levels of government, as Dr. Etches has a bit of that role of advocacy, I can tell you, I every day send me more. We've not only done that, but by our actions as a team here with public health and with the hospitals, we've exceeded all their expectations. Like, they weren't thinking Ottawa was even on the long term. We did it all before everybody else. And I said, give me more and we'll keep doing it, and we're ready to go. So they know the pressure's there. I think you're talking about an international and a national challenge right now. I think you're absolutely right that what you're hearing and what we're seeing is is a question of we've got the capacity to put needles in arms, but we don't have any vaccine to put in arms. That's the challenge we have.
Yeah, I think the plan locally is excellent. The infrastructure, the planning, I have no concerns about when the vaccines come in to get it rolled out in Ottawa. It's getting the vaccines in Ottawa that I have a problem with. I have a big problem with this. You're not to blame. You've done really good work, but this is something that I want council to consider. Dr. Etches, can you just confirm that Dr. Williams contacts you to discuss the local cases and seeks your input on whether or not schools in Ottawa should reopen?
Yes, the conversations go both ways. The Chief Medical Officer of Health has reached out on occasion to get input, and we have also, continued to reach out at this point on a weekly basis to discuss the situation.
And it's your professional opinion that schools in Ottawa should reopen now. Is that correct?
Yes, that would be my advice, given the harms we're seeing and the ability to control COVID transmission within schools.
Thank you. Both the WHO and the EU government 2 weeks ago were debating vaccine passports to help stimulate the economy, getting tourism going. It sounds like today the City of Ottawa is not planning to have, or to at least authorize, large events, summer festivals, summer events. I don't know what the plans are for the tourist season in Ottawa. We're obviously not going to have herd immunity by then, but is there any way we can have a slow transition to allow some activity to happen to help stimulate the economy safely? We're probably not going to have large festivals, but have those talks been happening, and what really is realistic for people to think about July, August, September?
We know that we need to continue to wear masks. We need to continue to have distance between people who don't live in the same house for many months into the summer. And the larger the event, the greater the risk. And so we will evaluate whether we have enough protection of older adults to prevent hospitalizations and severe illness, by the time we get to the summer. And that will make a difference, potentially. Our health system can function with fewer hospitalizations. We can, all want to avoid death. So I think this will have to be evaluated as we go month by month. But I can certainly advise that we need to use those behaviors we know work to keep COVID levels under control through to the summer and beyond.
Yeah, and I would add, Councillor, in posing your question, you've answered it yourself. I don't think we're there to make that assessment. And the only thing we can do as we've listened to Dr. Etches and we're still under provincial lockdown is tell partners to be realistic and say, yeah, we're not about to start discussing, plans to close roads and have a major event in Ottawa. We're nowhere near that. Perhaps as the summer event advances, the situation will change.
Thank you. My final question is, the vaccinations in our long-term care homes has gone well. Good work there. I think there was a question about vaccinations for our first responders. Can you talk about the staff who work in long-term care homes, who are with our oldest residents of the community on a daily basis? Have they been vaccinated? And is there a requirement that they be vaccinated in order to be working with our oldest residents?
So I'll talk about what's been done, and then on the requirement, I'll let Dr. Etches add a little bit of her analysis as well too. So yes, it's been a very successful team approach with public health, the city, and the Ottawa Hospital. We got in and did all our long-term care residents. The workers all got a first dose as well too, those that wanted it, and they're those who care for those residents as well too. So a family member that's a caregiver as well, that they've all gotten the first dose. And as of Saturday, we're going to begin our second round to go in. Unfortunately, because of limited supply, we have to prioritize. So we're going to be doing, as Dr. Etches indicated initially when she talked about the 21, 28 days, all the long-term care residents will get their second dose to be fully vaccinated. There will be a delay for the workers in those care facilities And then that'll vary as to the expert advice we're going to get from the province, but it may go to 35 or up to the 42-day limit. So that work's being done. We talked to you about initially about the math that they're currently analyzing, and they may have to boost vaccine around the province. So that's where we stand with the long-term care. And the next cohort that we have to do after we finish them is to get into our retirement homes next. So that's where we're going to go. But I'll let Dr. Etches talk to you a little bit more about the other part of your question.
The point I would make in addition is that while the coverage rate for residents is 92+%, we don't have that coverage yet among the workers or the essential care providers. Partly because when vaccine was first available to them, it wasn't as accessible, having to involve going to the Ottawa hospital and finding the time and the transportation. Also because they were first, it was absolutely new and people had questions and they needed their questions answered. And so what we anticipate is that percentage covered will grow over time. People will continue to be offered the vaccine as a priority in long-term care homes, whether they work or are essential caregivers or associated in some way with going into long-term care homes. So that will continue to be a priority. I'm sorry, I think I need a break in terms of, did that fully answer your question, Councillor Brockington?
Yeah, I just want to, again, just to finish, I have no significant issues with the planning you've done locally. I think you've done a great job. My number one issue is getting vaccines in Ottawa, and whatever anyone of influence can do to advocate and get more vaccines, we've got to get as many as possible. So thank you very much.
Thank you. Next on our list and also on planning and/or ARAC is Councillor Kitts.
Hi, everyone. Thank you very much for all the information you shared with us today. I'm late on the list, but I've been listening and taking notes, and most of the questions I had have already been asked and answered. I'm very happy to hear that you'll be engaging with rural councillors about the accessibility of vaccine distribution in those communities. So I'll look forward to that. So I only have one question left, and it's, we know that our mental health is really being affected right now, and I'm hearing from the community that people don't always know what's available or how they can access the resources that we do have. And as we heard today, we still have a long way to go. So given that a critical mass of our population will be visiting these vaccination sites, I'm wondering if it's been explored if we can make information available about the mental health resources that we have in these locations. So is that something that has been explored, or is it something that could be explored?
I don't think that we have seen the vaccination site as a place to provide information about mental health. So I think that's a great idea that we'll take back to the team. We are focused on promoting access to the existing mental health services. We have the Distress Center, which is open 24/7. We also have same day or next day counseling. There's no wait list for people who need support through the Counseling Connect program. And so I do encourage you to keep letting people know. There's a list of all of the services on our website. We're using new methods to try to reach people. We hosted an information session with the Royal about what exists and the supports people can have and how to stay mentally well. And we are hosting regular sessions on parenting in Ottawa, our site to support parents, pandemic parenting, getting through the school closures at this point. So we will continue to work with the Kids Come First, with GEO, the Ottawa Child and Youth Initiative, to continue to highlight the supports that exist. And, we need to address the stigma about reaching out. This is an incredibly trying time for everyone. And then some people are dealing with job loss and other challenges. And so, we need to keep an eye on our neighbors, on our friends and family, and pay attention to if someone seems to be withdrawing or losing hope. There is hope. we actually, can see that this pandemic will end. There are social services and health services and financial aid, that can be provided. So definitely want to spread that word. There's no shame in saying, I need some help right now. And we actually do see more people reaching out than we have previously, people reaching out for the first time. But this is, obviously we wish people didn't need the help, but we are encouraged that new people are accessing services where they may not have had them before.
Thank you very much. I know that Ottawa Public Health does put mental health at the forefront of its communications, and I just want to thank you again for all the information you provided us today. Thanks.
Thank you, Councillor. Next would be Councillor DeRuse, who has left for the meeting, but he asked me, Mr. Demonte and Dr. Etches, just to pass on his thanks for the work that you've been doing in the city. And Councillor Moffat is next, but I believe he's not on the call. And that brings us to, yes, Carol Ann, I can see you. That brings you to Councillor Meehan.
Thank you, Councillor Eglai. I'm supposed to be in that meeting too, but I just wanted to ask, thank you to everyone for all the great work. One thing you did say, Dr. Etches, earlier in this briefing was that we're seeing more workplace outbreaks. What can you tell me about those businesses? Where are those outbreaks happening?
It's actually across a number of different types of workplace. So there's no one sector. It's not just retail. It's not just restaurants. It's not just, distribution centers. All of these are affected. So what the common denominator is if the workplace, is not able to separate workers by 2 meters, that where there's situations where people are not wearing masks and they come into close contact, that will increase the risk for COVID transmission. So over and over again, we see a risk is for employees having lunch breaks where the mask comes off and people are in close contact and let their guard down. So there are some general principles. We're continuing to remind businesses about these places of risk and to support employees to have the space to take a break. Everyone needs to be able to have a break and obviously have their lunch. So trying to create spots where that is possible with less risk. So we continue to work with our business partners to spread that work through different employer networks as well.
Okay. I know that we said the phase 3 is going to hit the bulk of the people in Ottawa to get them vaccinated, but we were supposed to hopefully get all this done by September. Is that realistic that we can, if we start vaccinating in August, can we get it done by September when the kids are going back to school?
Yes, I have every confidence that we can vaccinate, say 75% of the population. With H1N1, we did 50% of the population in 2 months, right? And we learned from H1N1. We have better systems now. Okay. So there is no challenge with being able to complete that task. The challenge is vaccine supply. That I believe, with the city's leadership and support, the collaboration of so many, we can do this.
Okay, so I know we're not getting Pfizer, but do we know anything about Moderna? Do we know anything about AstraZeneca? Do we know anything about when we will be getting some of these other vaccines?
Well, the only thing we do know is Moderna has been approved, and the limited amount that we've gotten has been sent to the GTA, to the 4 gray zones, the hot zones, and as well, because it's easier to move around, has been used for the northern Indigenous communities, particularly the fly-in communities. That's where it's gone now. We don't expect to see any large amounts of Moderna arriving in Canada till later into March, I believe it is. Ultimately, I would assume we'll get some, but in spite of that, with regards to the other products, none have yet been approved for use in Canada. So that is the fact of the delay. So, but we're fine. We've been very successful with Pfizer, and I just hope we can continue to get large amounts of Pfizer, and we'll continue to trot down and continue to immunize our community.
Okay. And one last question: are we tracking City of Ottawa employees who possibly could be traveling outside the country. I'm asking a specific question for somebody who is concerned, I guess somebody within the city, about on our sick leave forms, are we asking people in the last 2 weeks, have you traveled outside the country? Are we concerned that people are using sick leave for quarantine when they're coming back? Is there any concern about anything that employees are doing in the city that might put other employees at risk?
So there's a lot of different questions in your question. So we've each manager does ensure that when somebody comes to the workplace, they fill out the criteria that, you have a temperature if you traveled outside. So that's being controlled to make sure that nobody's entering the workplace that is putting anyone at risk. And that's followed public health directions. We modified that early on. Our HR team modified that early on, and that's underway. Authorizations of vacations are done by each of the supervisors. That's underway. And I believe there has been indication that our expectation is city staff follow all the rules of that are in place at public health, which means currently there is no international travel, no travel outside, and we're under an order right now to stay home. So that would be the expectation that we'd have of staff.
So sick leave can't be used to travel then?
Sick leave to travel outside of the country or elsewhere?
I know it's not advisable.
Well, I don't know what specific case you're talking to. I think that would be a labor relations challenge for sure, and we could talk offline if there's a specific case you're referring to. But no, sick leave is not for that, not necessarily for travel for sure.
Will City of Ottawa employees be required to get vaccinated?
Councillor Brockington asked that question. I don't think we got to it about.
Okay.
You can't.
So I'm sorry, but.
Yeah, no, we can't force anyone to be vaccinated. It is voluntary. There's a whole bunch of charter issues, and that includes healthcare workers too. I mean, it's something that we would hope that healthcare workers understand the impact and how important it is and how safe this is. And like everyone's been saying on this, I'll be the first to line up when I'm in phase 3 and I'm able to get my vaccine for sure. So, but no, we can't force anyone to get a vaccine.
Okay. Just going back to the schools, just very quickly, Dr. Etches, is there any way that we are, maybe I missed this too, to work with the province to encourage them to take a look at Ottawa, to take a look at us opening our schools again because of our low rate and the fact that so many people have done well to bring those numbers down. Is there any hope for parents out there that we could persuade the province to help us here?
Oh, yes, I do think that the province is hearing our input and reassessing the situation, as I said, each week at this point. And so I expect there'll be some more, direction on schools opening in Ottawa this week.
Okay. I appreciate your time. Thank you for all your efforts and all your hard work. I guess I better get over to planning. Thanks. Bye.
Good luck in planning. I believe Councillor Hubel is already at planning. So I go back to the regular list and Councillor Menard, please. Appears that Councillor Menard may have left the call. So last but not least, and very patient, Councillor Cloutier.
Thank you, Chair Eglai. Thank you for your work, always ongoing on this file. Merci au Dr. Etches.
Thank you to Dr. Etches and Mr. Dumonte for your excellent work, your dedicated work. You've been at it for a whole year now, and we certainly appreciate everything that you've done.
It's a long haul. It's been a year for you and for members of our community. Many councillors who preceded me asked some of the questions with respect to reopening, with respect to, and I appreciate that. I think Councillor Deans had asked some questions and the rollout procedures. Just have a question with respect to marginalized communities who are living in a crowded condition. Where will we see them in the vaccination rollout, Dr. Etches or Mr. Dumonte?
Well, I can start. They would, because they're marginalized communities, they would be considered some of the communities that were disproportionately impacted when the research is done. So they would fall in phase 2 generally. Most of those people. So we're still not there, but those people would fall in that phase.
Thank you very much. Just a final question. What are the exceptions or the rollout for people who might have a medical condition and who cannot wear a mask on transit or in their place of work or whatever, who cannot wear a mask? How will they be incorporated into the vaccine rollout? Any priority for them?
Unless they fall into one of the groups that have been pre-identified, they're essential workers or they have high-risk health conditions. So you've talked about the condition, and Dr. Etch has said there's still work being done at the provincial level to define some of that, or they're in the groups of the older adults in phase 2, 80 and over, that type of thing. They wouldn't, that procurement about not having to being able to wear a mask doesn't fall in the criterion of the phases. And I stand to be corrected by Dr. Etches, but they would have to have a condition that would make them fall under the ethical framework. Not being able to wear a mask wouldn't be one of them.
Thank you all for the presentation today. Thank you for the questions by my council colleagues and for staff who've provided us with this information today. Merci.
Thank you very much. You're the last counselor, so I know we have at least one counselor's staff online, so we'll go there first. Chantal LaBelle, please.
Thank you, Councillor. We've received some questions from residents, namely seniors with chronic conditions who may not have family physicians. And in that instance, how would they go about being identified to receive the vaccine and being classified with priorities?
So Ottawa Public Health will let different populations know when it's their time to get the vaccine. So we will communicate on TV, on radio, through community associations, networks of older adults, community level, information distribution channels, everything. And it is clear to me that age is the most important factor. So we'll be starting with people over 80, then over 75, then 70. The province has not yet completely outlined which chronic conditions will be treated as important to prioritize beyond that. So we're really looking for a bit more guidance from the province. But the overarching approach will be by age, which should be easy to communicate to the population. And they can always turn to Ottawa Public Health's website. That will keep things updated there.
Okay, so I guess one other question, and it kind of falls a little bit in that same aspect, was if somebody felt like they were more high risk due to a chronic illness, that would put them in that category, since that's not yet defined, and they were told not yet, we wouldn't really know where they would fit in yet at this point.
No, I think the guidance back to people who are asking questions about when me, we're not going to be able to get to larger numbers until starting in March, and really beyond. We're looking at still having to get to high risk retirement homes, other congregate settings, First Nations, Inuit, Métis adults, people who are receiving chronic home care. These are clearly defined populations in phase 1. So I think that we are going to have to adjust as the vaccine supply adjusts, and if we can move people up, we will.
Okay, and so you just mentioned as well for the communication strategies. So I know the social media strategy has been very effective, and in terms of other strategies, can you provide a little bit more detail for those who don't have social media? So I think you mentioned TV, and what else is there going to be?
Yes, there's a whole communications team established under the operations section. So Pretty much if you name a communications channel, we'll be using it.
Okay.
But we do know radio is important, for example, to reach older adults who might not have internet access. We will be relying on counselors as well to spread the word through their networks. I'm not sure if Mr. DiMonte wants to elaborate any further.
No, I think it, as Dr. Etches said, it's broad-based. Any communication strategy you can think of, the team is currently looking at, and we'll broadcast that, understanding that, as you've indicated, different groups may use different strategies. So we want to make sure that we blanket that information, and again, through the counselors' channels as well too. That'll be helpful as well.
Absolutely. Thank you so much.
And thank you, everyone. That's all the counselors and all the staff we had on the line. So I want to thank my colleagues for their questions and for their engagement. The city will be hosting a media availability 15 minutes from now, so at 12:30. Should any media have not already registered and wish to join, please reach out to the city's media relations team. And thank you once again for joining us. Merci et bonne journée.
Thank you for being with us. Good day.
Invite questions from each media agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions des médias par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. So we will now start with Joanne Chianello at CBC Ottawa.
Hi, sorry about that. It took me a bit to unmute myself here. That was such a long technical briefing. I'm trying to think if I have any questions now, but one thing I did want to ask about is, as we look to keep transmission down, we're trying to both keep the restrictions going, or at least our own personal measures while we wait for the vaccine to come in. And one of the things people are worried about is the new variants that could be more contagious. Could you give us an update as to how many variants, how many cases of new variants, whether it's the UK or South African or British, are in Ottawa right now? What do we have confirmed right now?
What we know is that earlier, a little while ago, there was one person with a travel history to the UK who tested positive, and then that sample was retested and the variant was identified. And we have been doing that, and now it's being done routinely, that when people are traveling and they test positive, we send that sample for sequencing to see, or screening first, and then sequencing to see if it is a variant of concern. I think there's only one other that has come through out of the testing that's being done. And again, in a traveler who was and is self-isolating. So the province, has implemented new guidance again to follow up with people who have been traveling and testing positive, and when the variants detected. We were already treating these as situations where we wanted to do everything we could around containment. I think the broader context here, excuse me, the broader context here is that it is about all of us maintaining the behaviors like wearing masks and keeping 2 meters apart that will prevent the transmission, rather than trying to catch up with it. If it's here, waiting for somebody to get a test and following up on those test results is all after the fact. So it is those basic measures that will help us keep COVID under control, whether it's a variant of concern or not.
Can I get that in French, please, as well?
Nous avons eu déjà un cas où
We only have one case of the variant from the United Kingdom, and it's associated with a person who traveled from the United Kingdom, and and that person is in self-isolation right now. Since then, we've been actually doing the genome sequencing of all tests done on people coming back from a travel abroad. And I believe that the province is supervising the situation very closely, monitoring the situation very closely, and there's only one other case. The person that have tested positive is presently in quarantine. It's always important, of course, to prevent a transmission. So whether it's the new variant or some other or the original variant, it's really important to abide by the protocols, the directives, because everything that we do happens after the fact, after contamination has spread. So it's important to respect all the preventive measures.
I'd like to also add, please. What we heard today in detail is you folks have a very good sounding logistical plan for getting the doses into the arms of many people. You are just waiting on the supply. The supply is something that's pretty worrisome to people. Mr. Dumonte, have you heard, for example, like what assurances are you getting, if any, from the province that Ottawa will get its per capita share? I know at the end we will, but moving forward in the next few months, especially that phase 2, when you see that other places are hotspots, I mean, I'm happy we're doing well here. The numbers seem to be coming down, but does that play against us? Are we going to get our per capita share? What have you been told so far?
So yeah, initially per capita was the model that was going to be used across the province, but as we've talked this morning, as we enter this new reality of are we going to get vaccine, or are we not going to get vaccine in Canada, the vaccine is a provincial asset. That what we have here in Ottawa belongs to the province, and what everybody has elsewhere belongs to the province. So they're looking at the priority groups and those who are the most vulnerable, and to assure that we can achieve those objectives first. So for instance, we have to have enough vaccine to complete our long-term care second dose. So if, as I mentioned, we're running the math now, the Ottawa Hospital and the team is running the math now, if we're a little short, they're going to have to look to be able to allow us to get the appropriate vaccine to complete that task. Then we're supposed to go into our retirement homes. We would be out of vaccine. So I guess directly to your question, I think we're in not troubling times, but in times where we're going to have to make some difficult decisions at the provincial level to ensure that our most vulnerable and those who the medical team has identified that are most critical, the public health team, get the vaccine, and that's going to be done provincially. So yeah, there may be now movement of vaccine from different jurisdictions. We may be gaining in certain times, or we may lose vaccine because it's got to go somewhere else. But I think that's going to settle down as quickly as we're able to see Pfizer start returning to Canada, and we starting seeing regular shipments again. But Joanne, that's kind of up in the air right now, and I deal with facts and with data, and right now that's a bit of a challenge. And maybe Dr. Etches may want to add some of her thoughts too, because I think it's important to understand we're doing this for the benefit of the most critical patients.
Sure. And before I get Dr. Etches, I'm sure my Radio-Canada colleagues and other colleagues would like that answer in French too, if you don't mind. Thanks.
Donc essentiellement, le vaccin que Ottawa.
So essentially, the vaccine that Ottawa has is not the vaccine that belongs to Ottawa proper. The vaccines are distributed by the province. So our present priority is to make sure that among the priority groups, as defined by the scientific group, that our team is able to analyze the impact of not having any new virus vaccine supply this week, and how we have to adjust our priorities. If we have a shortfall, we will make a report to the province, and I assume that they will take the proper measures to give us what we need so that we can complete the vaccination within the long-term care facilities. And we hope that within the coming weeks, Pfizer is going to resume regular delivery of the vaccine. and that will allow us to finish long-term care facilities and then start with retirement homes.
I would just say that I do support the direction of the province right now, given the lower supply, to protect the residents of long-term care and retirement homes. I think this is very appropriate and really makes a lot of sense. There's a National Advisory Committee on Immunization recommendations when we're in this kind of situation with low supply and community spread, that it is acceptable to delay the second dose up to 42 days is their recommendation. And so I think getting that population of residents protected makes sense as a top priority. And Joanne, we do have 3 people who have been confirmed to have the variant of concern in Ottawa. Again, our team is making sure that all of the follow-up is done. And in fact, with all travelers, this is a flag for us to make sure that those people are receiving the priority follow-up.
Thanks, Dr. Etches. Can you just, is that the UK variant, or is any of those the South African variant? Do you know?
I don't have that detail. We can send that in writing. I think.
No problem.
Yeah.
I think it's the UK one. I don't think
the
there's any
first one
South
was
African
definitely the UK.
Yeah,
On the
okay.
other 2, I haven't got that information
All
right now.
Thanks a lot. Thank you
Thank
both.
you very much. We will now go to Chris Curries at City News. Chris, are you there? Okay.
Yeah, good afternoon. Sorry, I was muted. First time on Zoom in a while. On our current timelines, I know we have some shipment delays. When do we expect to vaccinate all of our long-term care residents, both doses?
So the team re-begins the mirror image of the first that we did. We started, I forget the exact date, but I know the first of the long-term care homes is this Friday. And I think it took us about a week or 11 days to do them all. So 11 days from Friday, we should be complete the second doses.
That's 11 days from this Friday, right?
Correct.
Okay, perfect. And just to follow up, anyone in Ottawa, any instances of anybody getting the vaccine and having any adverse effects, anything like that?
I'll let Dr. Etches talk about that, give you more detail.
Yes, so we have a system of reporting any adverse events following immunization so they can be investigated. Healthcare providers are required to report that to local public health. They may or may not be events that are caused by the vaccine. And so far, I think we've had a small number of people complaining about greater redness around the site of injection for lasting for a longer period of time, for example, that you might expect. I think there was one instance of anaphylaxis, which is an allergic reaction. All of these are investigated and then reported upwards to the province and the federal government. It's the federal government that's able to look across the whole country and assess whether there's anything here that seems out of normal in terms of what we would expect from a vaccine. And I've listened to Dr. Tam, who's looking at the national or pan-Canadian numbers, and she is reporting that they're not seeing anything out of the ordinary.
Perfect. Thank you very much.
Thank you very much. Moving on, we will go to Leah Larocque at CTV Ottawa.
Good afternoon, everyone. My question is for Dr. Etches, and just going back to schools. We've heard that you are supporting reopening schools as quickly as possible. We're hearing from sick kids with their report last week. I just want to go back in your discussions with provincial health authorities. What are you hearing about the criteria that it's going to take for Ottawa to reopen our schools? And is there a threshold of levels of community transmission we need to be under in order to reopen our schools? And if so, is Ottawa close to that?
Thank you. The province hasn't given a specific threshold, and I respect that because one number does not tell the whole story. Just like when you ask me what's happening with COVID in Ottawa, I tend to point to many different data sources. So there's not one, rate of COVID that was raised as a criteria. Rather, the Chief Medical Officer of Health is looking for a downward trend in the COVID levels. The percent testing positive is dropping, the reproductive number is dropping, where there are higher numbers of people testing positive, that is linked to potentially outbreaks that are contained or controllable. So I think that this is where the input of the local medical officer of health is one of the things that they're looking at, to understand, do we have confidence that we can manage the situation? And so that's why I've conveyed back that I do believe we can use the measures that worked in the fall to be able to open the schools and limit transmission within the schools.
And could you just reiterate what are some of your concerns about kids not going back into school right away and this sort of moving deadline? Parents aren't exactly sure when they're going back. If it could be before March break, it could be next week. What are some of the concerns that come with that?
We like to make our decisions based on evidence and measuring the impact of school closures. One of the things we've done throughout the pandemic. So we saw that parents of school-aged children reported highest levels of distress in March to June when schools were closed. That mitigated a bit when schools were open in the fall. And so we expect, again, the situation is challenging right now with the schools closed. We see that uptake in service utilization for mental health services for children and youth. And we see the challenges that people are reporting with being able to work and teach at home and parent. And we have, the experience that, in fact, some people are not able to go into work because they're trying to balance these things at home. So there are many different kinds of harms that we see with schools being closed, which lead us to want to open them as soon as we can.
Thank you.
Thank you very much, Leah and Dr. Etches. We will now be going to Craig Lord at Global Ottawa.
Thanks very much. I'm curious, we still have a number of ongoing outbreaks in our long-term care homes. I'm wondering, how does an active outbreak situation in a care home affect the vaccine delivery on that site? How are the mobile teams or the people on site administering the vaccine adapting and having to deal with active outbreaks?
So I'll let Dr. Etches chime in a little bit on this one.
Yes, so we know what controls outbreaks is strong infection prevention and control practices. So the long-term care homes have been working with public health, with the hospitals, with Ministry of Long-Term Care and Ontario Health Supports, everyone reviewing those infection prevention and control measures that need to be in place during an outbreak. So they are things you've heard about before. We need to make sure that people are screened out if they have symptoms of illness, that people are wearing the masks and the personal protective equipment required, and that we still find benefit within homes of keeping 2 meters distance between people. So our vaccination teams are, whether there is an outbreak or not, they are conscious that they need to treat every interaction as a potential point of COVID transmission if precautions weren't in place, like the masks and the distance. So eye shields, wearing eye protection. So the measures actually are very similar. We know that it's important to protect the population, and with 28 homes, long-term care homes, and 15 now or so, I believe, are in outbreak, we can't just skip them. That population deserves the same protection, and so that's what the team has been doing.
Thank you. And I guess this is maybe more of just a technical medical question, but when someone say has tested positive and they currently have COVID-19, do do you vaccinate them, or do you let their natural antibodies take care of it, or how does someone maybe with an active case of COVID, what is the vaccine approach there?
So there are people, we can take the long-term care homes as an example, who have tested positive previously to COVID-19. And because we don't have good data about how long someone's natural immune system generates antibodies, we'd expect in that situation with an infection, how long that lasts, we are still vaccinating people who've been previously testing positive for COVID-19. Now, if someone actually has a fever at the moment, then we are not immunizing people with symptoms of illness because that would make it harder to assess if somebody had an adverse event following immunization, to tease that apart from the actual active infection. But there is no contraindication to vaccinating someone who's previously tested positive.
Great, thank you very much.
Thank you very much. Nous allons maintenant passer à Julien Paquette à le droit.
Oui,
Adrien Paquette from Le
je crois
Droit.
que la question, ça va être pour M. Dimonté.
My question is for Mr. Dimonté.
Je comprends que
I understand
l'équipe travaille très fort puis
that the team is working very hard.
Beaucoup d'éléments qui sont un peu en suspens en ce moment, mais
there are a number of issues.
J'aimerais ça un peu comprendre pourquoi
Right
on a un peu la même réponse que la semaine dernière
the shortfall
par rapport
supply, but why is the answer the same as
à
last
savoir
week?
finalement si on va avoir
When
assez
it
de
comes
doses
to knowing
pour
are we going to have enough
donner la deuxième
doses
dose à tous les
to administer the second
tous les
dose
résidents de
to
foyers de
all
soins
of
longue
the
durée.
residents of long-term care
Je ne sais pas si
facilities?
vous comprenez un peu ma question.
Do you understand my question? Why? I don't understand your allusion to last week, because last week you were saying that
on comptabilisait les chiffres, on était encore en train d'essayer.
that you were looking at the numbers. Yes, all right. Well, last week we were looking at the numbers because we were counting on a certain supply that we did not receive. And in the meantime, the province has changed also. We wanted to respect the interval of 21 to 28 days between the two doses. But now the province has extended that interval, in fact, last night. Now it's for residents 21 to 28 days, but for the staff who are working there and who have received the first dose, we can have an interval that goes as much as 35 days. So while we're at it, during the press conference, people are doing an analysis, but for this week, we're going to be able to resume the second dose of vaccination. There will be a shortfall, but that information is going to be given to the province, and we hope that we will get the doses that we need from elsewhere to complete the vaccination program. So the first analysis was done with different intervals from the ones that we've now adopted, and that's the reason why. And public health agencies got the mandate to look at the situation, and the province re-examined the situation. So how do we administer a second dose to all long-term care facility residents? So they are looking to see if there are adequate supplies. And that's why our position changed slightly from last week to this week. Thank you.
Puis je vais revenir un peu sur ce que vous avez dit plus tôt
And I'm going to come back on
concernant
what you said
le fait que
earlier,
les doses de vaccins, finalement, sont une propriété de la province.
saying that
Comment est-ce que vous
vaccines are the property of the province.
Par rapport à cette situation-là? Est-ce qu'on est en bonne position?
So are we in good position
d'avoir les
of receiving the vaccine doses, the number of doses that we require from the
ou
province when it comes to the administration of the second dose? Well, what I can tell you is that the objective for all of Ontario is to vaccinate priority groups. In other words, residents of long-term care facilities, they should get their second dose first. And that's the reason why we are looking at the doses that are available throughout the province, and it's possible that it will be necessary to shift some doses from one area to another so that the program can be completed. So I don't think that there is any particular region that has an advantage over another. We're looking at all the resources from a provincial standpoint to determine who needs, but the priority remains for all of the province to vaccinate the most vulnerable who are seniors in long-term care facilities. So that's the priority for the entire province. So we're not at a disadvantage or at a particular advantage. And then, of course, we're going to vaccinate the residents in retirement homes. And that's going to be the next step. So I think the whole of Ontario is taken is taken as a whole to make sure that the people of Ontario are protected. Thank you.
We will now be going to Elizabeth Payne at the Ottawa Citizen.
Hi, thank you. I just want to go over something about when the average person or the bulk of people in the city can expect to be vaccinated. I know earlier this month, I believe it was, the mayor said 2/3 of the city would be vaccinated by Canada Day. Where do we stand now in terms of what you know and when most people will get vaccinated? I'm not sure who that's to though.
Yeah, I can chime in, and Dr. Etches too, because I think you're asking us both to look into a crystal ball right now.
Sure.
I think, Elizabeth, it's a very appropriate question, and I know we all want to get there. It really is. It's not a question of not being ready as a city. Like we've said, Dr. Etches, the hospital teams, the city, we've got our process in place. Our structures are ready. The teams are good to go. We've got our centers ready. We just don't have vaccines. So every delay that we have obviously pushes that objective or that moment that we all want away. Initially, had things continued on the pace they were going, I think that was perhaps aggressive or optimistic, but we could realize that absolutely. Now, every week that passes and that the vaccine supply is problematic, it's just basic math. Things are going to get pushed off. So I don't know how realistic that is. I think we're looking more at widely available for you and I, for instance, to get our vaccines. If we don't fall in one of the categories, we're looking at sometime in August. But that said, we've also got a plan that is scalable, and if sometime in August we start getting unlimited amount of vaccine that we would need, we would scale up to do maximum vaccination. So perhaps we could then regain the time that was lost, I guess is a better way to put it. But I think we're looking at crystal balls. I would say, sitting today with no doses coming in this week, significant doses really reduced next week and perhaps the week after, and then I'm always one of these individuals that, like, when we start seeing their doses, are they going to come in regularly by the amounts that are produced, and we get that after several weeks, then we're nowhere back on a normal beat. Then we can start doing some predictions of timelines, but until then, it's a little difficult. I don't know, Vera, if you've got any thoughts on that. Sorry, Elizabeth, if you didn't see her, she nodded no. So.
Oh, sorry, I missed that. Thank you. Okay. Okay, so, and my other question, if you can help me answer this, is when Ottawa Public Health with the mobile teams became the first in the province to take Pfizer outside of hospitals, was that the initiative of Ottawa Public Health? Is that why that happened at that date, or was that the initiative of someone else?
I don't know about initiative somewhere else. It was something that I had been talking about, that we were looking at that, and Dr. Etches perhaps can have a little bit more information on that. But as soon as we were able to, the next day we went with it.
I think it was a provincial conversation with Pfizer, is my understanding, that the company had indicated that the vaccine should not be moved, and the province, heard from the field. They heard from us that we were really interested in getting the vaccine out to long-term care homes, and so once there was the ability to move the vaccine, perhaps because we had said we're willing to do this, that may have helped us be ready to go and try it out as soon as it was available.
And Elizabeth, if I may just add, not to toot our own horn, but really to toot our own horn, our hospital partners, when we did receive the vaccine, the Ottawa Hospital was very much outperforming, I think, a lot of other areas in the province. So they saw we were not only keen, but we were organized and effective. So I guess when they made this decision, they looked at us, and as Dr. Etches said, and then we proved that right. When we got it, we were able to get into our long-term care facilities quite quickly and get them all done. So I think it's kudos to the public health team and to the hospital team as well.
Okay, I not to further this, but it wasn't the prodding of Ottawa that made that happen on that date. The province, that was when the province green lighted it, and then you went ahead.
Correct.
Okay. Thank you.
Thank you very much. We will now be going to Christina Spencer at Ottawa Sun.
Hi, and thanks very much for taking 3+ hours of questions from councillors and us today. My first question is about outbreaks at businesses. Dr. Etches, you've talked about some of the commonalities in those outbreaks at private workplaces and businesses and so on. Can Ottawa Public Health or the city not start to publish the list of workplace outbreaks, much as you do with long-term care and retirement homes? Is that not a possibility?
We have added to our website that reports outbreaks to the public, our dashboard, in terms of we give the details of every outbreak, in terms of the number of workers and patrons or residents affected. The workplace right now is broken down by the kind of sector, so whether it's retail or food production. We do release the names of individual workplaces when the public needs to know that there's an ongoing risk if we don't have another way to reach the workers or the patrons. So typically in our outbreak approach, we are able to identify who the close contacts are and do the follow-up we need to do with high-risk contacts. If there isn't a way to do that, then that's when we release the name of a business.
So you can't, sorry, this is not my follow-up question, but you cannot just automatically release the names of businesses whenever there's an outbreak.
It's not desirable in terms of the stigma that's generated and the impact on businesses. We need to be able to work with businesses to be able to get the information and do our follow-up. That works with individuals. We take a positive approach to support people to do the right thing, and if we run into a challenge with a business, we can do the same thing again we do with individuals. If we have to issue an order, we would. But we're fostering an environment where we're working with workplaces to protect their workers, to make sure that they have the measures in place. And again, if there was a risk to the public, we would let the public know.
Yeah, sorry. My second question is, thank you for that, by the way, follows up on Councillor Meehan had been asking, I think, about whether you can force city workers or others to get vaccinated. And Mr. DeMonte, you gave a very good response about the charter issues there and so on. Is there a discussion or a mechanism, however, about city or municipal or health workers who are public facing in their jobs and don't get vaccinated? Is there discussion about modifying their jobs in any way, or sort of finding a way to keep them, since they are people who risk others, they haven't been vaccinated, let's say, is there a way to keep those people from being a risk to others as we go on or go through this process?
I think what we need to, yeah, we need to put this in context with what we know about the vaccine so far. We know that the individual people who are vaccinated are protected against severe disease, hospitalization, or death. And we don't yet know that that vaccination prevents them from having an asymptomatic infection that could be passed on to others. So it's not like there's a group of people now that are vaccinated and they can forget the masks and they can forget the distance and they're safe for everybody. No, they still could be infected with COVID-19. And so there is no difference between the measures of personal protective equipment, the mask wearing, the distance, the screening in high risk settings that needs to happen. And so there's no rationale for treating people differently. We need everyone to maintain those good behaviors that prevent COVID transmission. And we want to, encourage people to be vaccinated. We're seeing very positive signs in Ottawa. 83% of people reporting they will be seeking the vaccine when it's available. That is what we want to build on. People are ready. They're looking for the vaccine. We will make sure that they can access it as soon as possible.
Thanks a lot.
Thank you very much. We will now go to Laura Egertson at Ottawa Magazine. Laura, are you on the line? Laura, I see you are unmuted, but we can't hear you. Okay, so we will move on, but Laura, please feel free to send us an email with your question that you would like to ask the spokespeople. On va maintenant passer à Antoine Trépanier.
Antoine Trépanier. Hello. Well, first of all, I'd like to know how many people have been vaccinated twice, who have received their second dose, and how will the Pfizer delay change your planning this week and also next week and the weeks after that as well? Well, I'll start with the second of your questions. I don't yet have all the details on the second doses that have been administered already. We should get that later this week. First of all, planning has changed completely. We had planned on a process based on regular delivery of doses from Pfizer. Our goals had been set out based on what the province had told us we would be receiving, and that's how we had planned the vaccination of seniors in residences, for example. Our goal was to administer a second dose between 21 and 28 days. Now, because of the delay, and this is what the province has asked us to do, we'll be vaccinating residents in long-term care facilities. Will be administering the second dose, rather, 21 to 28 days after the first dose, and others who've already received their first dose will have to wait up to 35 days. This is a request that came yesterday from the government. Now, this information is currently being looked at, and we'll be getting back to the province to actually indicate what the impact of the delay in the Pfizer deliveries will be. And Dr. Etches, do you have the figures on the number of people who have got their second dose? No, I don't. Not really, no. But I can explain. It's only a small number of people who have received their second dose. We started at the clinic at the Ottawa Hospital. Now, it was workers in long-term care facilities who were vaccinated at the hospital. Now they've received their second dose. But as Mr. Demonte has just explained, that has come to a halt because of the delay in the Pfizer deliveries. Now, the second dose for residents of these long-term care facilities, well, that'll start next week. There are almost 4,000 people who will receive their second dose over the next week and week and a half or 2 weeks. Thank you very much for that answer. My second question deals with what Mr. Brockington asked earlier about the discussions that you're having with the provincial government. I'd like to know, what arguments are you bringing to bear to convince General Hillier, but also the provincial government, to make these doses available to you, given that our figures are on the way down in Ottawa? So what are your arguments? Can you tell us? Well, I'll start. I understand your question, of course, but we're not putting forward arguments. We have goals which are set out by the province to vaccinate long-term care residents. They are at highest risk. That need applies to the whole province, not just Ottawa. It applies to Toronto. It applies to all areas of Ontario. We all have the same goals. We're now in a situation for General Hillier and for ourselves where we don't have enough vaccines to provide the second dose to everyone in that first phase. So we have to look at what we have. We have to vaccinate residents first. We're currently doing our analysis to make sure, or to see rather, how many people we can vaccinate with the vaccines we have left across the province. We might have to redeploy those vaccines to make sure that those in long-term care facilities get their first and second doses. That's our goal. It's all determined by the number of vaccines we have. And then there's more demand than supply, of course. So we have to prioritize the most vulnerable, which are the residents of long-term care facilities. There's no fighting, no squabbling, no negotiation going on. We're looking provincially at what we have so we can actually complete that goal. We look at how many doses we have, and we have to redistribute them across the province, and we have to do that until deliveries pick up again. Thank you. Thank you very much.
One last attempt for Laura Egerton. Your mic, otherwise I have the question handy. Okay, we still can't hear you. So I have the question here from Laura Egerton at Ottawa Magazine. She is asking if both Mr. DeMonte and Dr. Etches could tell us when they heard the news that the supply was being distributed, from who they heard it, and what they were doing at the time.
Oh, sorry, it's Vera Etches. I guess you know that. The way that we've been getting updates on the vaccine supply and the plans to distribute it is through Teams call with the province, the Ministry of Health, along with other provincial contributors to the vaccination campaign. And they have been having those calls or Teams meetings with medical officers of health, as well as the hospital CEOs, where the vaccine's been distributed. So that shows you the partnership, that it requires all of us, sites where the vaccine's housed, the ministry providing the overall plan and direction, and the medical officers of health leading the overall implementation expansion of the vaccination programs, and of course here in Ottawa with the leadership of the City of Ottawa. So.
And I'd add the same thing. It was on a call with General Hillier and the team there that I had heard that was a possibility, that they were a little worried. I'd shared that obviously with Dr. Etches and our hospital partners, and then that evening they got confirmation that the official confirmation that we weren't going to receive anything.
Thank you very much. And then the reporter's follow-up is, what have you both been told about why Health Canada has not yet approved AstraZeneca, and what timetable you might expect on that?
I have nothing to add. I have no information on that.
And I don't have any information on that either.
Thank you very much. So this is the last of the reporter questions. This is all the time that we have as well. C'est tout le temps que nous disposons. Thank you very much for your time, everyone, and your patience, and have a great day.
Thank you, everyone.